Hello, everyone. Good afternoon. I welcome you all to the most talked about summit of 2021, Aarogyam, the Healthcare Entrepreneurship Summit. I am Harsiddhi Shah, Senior Associate Programs at AIC GUSEC, that is the Atal Incubation Center at Gujarat University. AIC GUSEC is a not-for-profit company that aspires to become a change agent by identifying, nurturing, and supporting ideas with impact. For this, AIC GUSEC offers a collaborative, no-cost incubation program to for-profit social entrepreneurs and acts as a bridge between the solutions and problems of the society to the nation. We are here to witness the most talked about summit of 2021, Aarogyam, the Healthcare Entrepreneurship Summit, which is organized by AIC GUSEC and TIE Delhi. This is a one-of-a-kind healthcare summit that focuses on the healthcare sector and promotes innovative ideas that lead to better measures. Before we start, we would like to thank Niti Aayog, AIM, that is Atal Innovation Mission, Gujarat University, and Startup Gujarat for supporting us. We would also like to thank our outreach partner, Head Start. Healthcare and innovations in healthcare are the most trending discussions since COVID. Healthcare innovations that focus on creating impact in the industry, being affordable, solve social and health problems are not cheap and need capital for research and testing. We have already witnessed that problem. To create awareness and make these innovations reach their goal to go global, we are here at the Aarogyam Summit. We have also organized a challenge under the Aarogyam banner for all the ideators, innovators, and entrepreneurs from the healthcare domain. And the last date to apply for the challenge is 30th October 2021. We request you all to visit aicgusec.org for more information on the same. Let's get back to today's summit. Today's summit will stir an expert-level discussion about the new innovations in the healthcare continuum. The panelists will talk about the gray areas where the scope for innovative opportunity exists, how to tap into it, and over and above that, how to access the various funding sources available for such healthcare innovations. With this, without any further ado, I would like to invite our chief guests for today. Our first guest is Rahul Bhagchandani, Director, AIC GUSEC. I request Rahul to please share his views. Thank you. Over to you, Rahul.
Thanks a lot, Harsiddhi, and a very good afternoon to everybody who has joined us in Aarogyam, the Healthcare Entrepreneurship Summit, organized by AIC GUSEC. I'm pleased to welcome you all for this wonderful initiative that has been put together by our Atal Incubation Center. As you all know, that since COVID-19 has hit, healthcare has become the most important and paramount area of discussion, of innovation, of importance to not just public policy, but also to the entire globe and the country. What we need today is innovations that could solve the challenges that are posed by not just COVID, but what other pandemics could do in the future. Access to healthcare is one of the most important rights as human citizens, and our innovations, our startups could go a long way in order to address this rising challenge of our country as well as the globe. I'm pleased to share with you that we have about 30 startups at AIC GUSEC that are actively working towards various social impact Gujarat University ecosystem of innovation and entrepreneurship to drive various innovations that are solving challenges of the society. I hope that you all will leverage this platform being provided by the AIC GUSEC and Gujarat University which is to create solutions to problems and take them one step forward. We will help you to realize your challenges, your dreams. Gujarat, as you all know, is the #1 state for startups. It has been actively working towards developing the startup ecosystem as a whole. And various initiatives of the private and the public sector have come together to make Gujarat a very popular destination for startups. Under the Aarogyam summit that we are doing today, we are bringing together various minds to share and ideate on what could be the right platform for healthcare innovations. But we also have the Aarogyam challenge, as Harsiddhi mentioned. We have prize money and grants of up to 30 lakh rupees, as well as investments from private partners of Gujarat University startup ecosystem to help our startups take their solutions to the next stage. So without much further ado, and in the interest of time, I would like to conclude my address by inviting you all to leverage the benefits being provided by our Atal Incubation Center, AIC GUSEC, and take part in this challenge. And I hope this session and this summit would be a great experience for you all in order to get the right perspective, to get the right solutions in place for our healthcare challenges. Thank you so much.
Thank you so much, Rahul, for sharing your time with us. Our next guest is Geetika Dayal, Executive Director from TIE Delhi, NCR. And I would also like to mention that we have Nitin Agarwal from TIE Delhi, who is here with us to support us. Thank you so much. Over to you, Geetika.
Good afternoon, everyone. It's a great pleasure to be here today for this summit, Aarogyam. And of course, I must start first of all by thanking Rahul and the entire team of Gujarat University, AIC, the Atal Incubation Center at Gujarat University, GUSEC, for the wonderful work that they have been doing. Today, you are seeing one example of what they have been organizing for you as the Healthcare Summit and the Challenge. And I invite all of you to wholeheartedly participate in that, submit your details for the challenge as well. But personally, we have been witness to a lot of good work that they have been doing over several months. I have to, of course, also compliment the state and the state government, because even in the state ranking framework, Gujarat has consistently been a top performing state as far as startup ecosystem and entrepreneurship is concerned. And it's simply because of the wonderful work that people like Rahul and the entire team, Dheeraj and all the others put in together, to create that ecosystem. So first of all, our big thanks for giving an opportunity to TIE Delhi NCR to be a partner, to be an ecosystem enabler for you and a knowledge partner for the programs that you do. It's a privilege for us to be part of this exciting journey. From a perspective of TIE, we have a single-minded mission of fostering entrepreneurship and helping startups to become successful. With that mission in mind, TIE was started in Silicon Valley in 1992. And it was a group of people from the Indian diaspora who had struggled, who had gone there and created their own success stories in the tech sector. And when they came together, they realized that what they were missing is primarily the opportunity to connect with the right people and to get some mentorship. And that became a way for TIE to come together informally and say, okay, let's share our experiences and help the next generation that is going to come across to us. And with that mission in mind, they created a platform which could provide networking, mentoring, and knowledge sharing, very similar to what we are seeing here today. TIE has, of course, had a long journey now. Since 92, we are now spread across a network of 61 chapters in 14 countries, pretty much doing the same thing, creating economic growth through the process of entrepreneurship. TIE Delhi NCR came into existence towards the end of 99, early 2000. And it has some, illustrious people who came together. So all the companies that have now become a lot of household names, whether it's Make My Trip or Naukri.com or IndiaMart and many others, are the people who are, driving it on the board and on the governing council. And primarily the intent is to be able to work closely and help create more people who can give back to this ecosystem and create a network of entrepreneurs. As part of that, we have special interest groups that are cutting across sectors such as retail, education, clean tech, sports, food and food services, and many others, women entrepreneurship, social entrepreneurship, etc. Healthcare as well being one of the main ones that we have as a special interest group, which is what brought us to this program to come together. And many people who are going to speak through the day, through this session that we have over the next few hours, are people who we have seen associated with TIE for several years and who have been in this industry for a long time. Of course, it has all now come into a lot of highlight because of COVID and the pandemic, etc. But they have been very sort of passionate proponents of this sector and what it can achieve. And we are really happy to see how the startup ecosystem has come together in the healthcare space. And the opportunities have opened up tremendously. The one thing that we also found is that because of the pandemic, the pace of regulatory sort of approvals and compliances also started to keep pace with the kind of disruptions that were happening for startups in the marketplace. So that's very important, where there is a sort of a good marriage between the policymakers, the industry, and the startups. And that, of course, will propel growth further. And we are all there to support you, of course. We would love for you to remain connected to all of us, both at GUSEC and at TIE, because there are several things that we do through the year, whether it is about programs, events, cohorts or training sessions or mentoring opportunities, the opportunity to get connected to investors and to pitch to them, and to, first of all, understand who are the investors that you should reach out to, when you should reach out to them, how much money you should ask for, who are the right investors for you, and then how to use the money that you get. So all of those things, come to you literally from the horse's mouth, the people on the other side of the table, as well as those who have already gone through that journey. So we have many such opportunities to learn and to also be able to get showcased at different programs. But at the same time, for you to also pay it forward and find an opportunity to, help somebody who you think might be able to benefit from this as well. So it's obviously a journey of give and take. What I would love for us to do now, of course, is to go straight into the program at Aarogyam, of course, a virtual summit, which is going to focus, as you've seen in the agenda, on preventive healthcare, precision diagnosis, and treatment in a timely and affordable manner, which helps to improve workplace and workflow that patients have at centers, clinicians, technicians, radiologists, and IT support as the ecosystem that surrounds that workflow. And a very, very exciting role that I have been given at this conference, and I'm delighted to do that, of course, is to introduce our speaker, our very, very illustrious and accomplished speaker, Dr. Rana Mehta. And it's time for his report presentation. He's the partner and lead healthcare at PwC. We've had the opportunity, like I said, to know him and many of the other speakers for several years. And he has 21 years of experience in strategizing, planning, commissioning, and operations of over 75 hospitals and healthcare systems, not only in India, but around the world. And during his decade-long stint with Apollo Hospitals, he was instrumental in commissioning and operating the group's hospitals that you see in New Delhi, as well as Colombo. Dr. Mehta's views are extensively sought by both international and domestic media on a variety of matters affecting healthcare in the subcontinent and globally. And I can personally, of course, vouch for that as well. because we have reached out to him several times to get his views on many of our sessions. So with that, once again, congratulations to the organizers for a wonderful program. A warm welcome to the audience. Our very best wishes. And Dr. Rana Mehta, pleasure to welcome you and be here with you today. We are looking forward to your report presentation. Over to you.
No, thank you, Geetika, and it's always a pleasure to be on the TIE platform. So I'll I think 2020 has been a momentous year, and we had a lot of with the pandemic. But as going ahead, I wanted to really focus what's the opportunity in healthcare, because in many ways, healthcare before COVID and healthcare after COVID, and like Geetika said, would be very, very different. So if I just share my screen. Geetika, is the screen visible?
Yes, it is. Absolutely perfect.
Right, great. So what I thought is I'm going to just take a few areas. And today what we're going to talk about is, what did the pandemic actually teach us? Who came out stronger, who lost out? What's transforming healthcare in this post-pandemic world? And then, what will catalyze growth in the healthcare business? So what are areas you should be looking at, saying these would be the next areas of growth? So I think this was a very, very different sort of pandemic, right? In a way, the whole idea was that, whenever you have a crisis, it's actually either an economic crisis or it's from a natural disaster, earthquake, fire, war. But I think this is the first time a healthcare crisis led to an economic meltdown. We also had a very humble assailant, something like the virus was, at the border of living and non-living. And all the virus in the world of COVID could, all come up in a Coca-Cola. So that's how small it is. So you never expect such a humble assailant. The third thing I thought what we saw is there's been exponential growth, but a slow decline. And even today, if you look, I was reading the newspaper, China yesterday, most of the flights stopped because again, they're having. So we have a third wave. Will we have a fourth wave? Will we have a fifth wave? We really don't know. And I think the complacency shouldn't set in, because after our first wave, I think India, we pretty much declared, saying that it was over. And we had a really bad second wave. The other thing I think what happened last year was, more than that, you had a lot of disinformation and conspiracy theories. And I think the reason for that is, it's so much, about the virus, finding out how it works. And I think clinicians are not being great at that. So rumor mongering, it's much easier to think, okay, this was a billionaire who got virus, to eliminate humanity. But that was another trend we saw. They always say, the first casualty of war is actually truth. I think the first casualty of the pandemic was trust. There was a lot of trust which was lost. And even today, it's not come back. Once we have the vaccine, you see the vaccine hesitation which is coming in. I think another important point was, universal healthcare. We always speak about universal healthcare. Is healthcare something you need to do for yourself, or is it a human right? And I think a lot of it's moving to the next. But finally, I think one of the biggest things, and why did we really survive? All the doomsday stories never happened. I think that's unique to, I would say, the human species, our ability to actually collaborate. So, a doctor in Bombay can actually collaborate with a doctor in Boston, but the virus can't do that. And I think that's the major reason we really managed to, control this pandemic. I wouldn't say it's over as of now. But, everything, obviously, there's always a silver lining. And I think there was an unanticipated catalyst. I think I live in Delhi, and for the first time I actually saw blue skies. The second thing, I would say, being a physician, every time during the monsoon, we have a lot of diarrhea and diseases. Diseases because people just don't wash their hands. But I think personal hygiene has gone up and the incidence of diarrheal disease has gone down in India. So, one of the collateral benefits, I could say. The third is, if we go look back at 2020 and say, that's the year digitization took off. And we'll say who was to actually take the credit for it? Was the CEO of the company? Was it the CFO? Was it the CIO? No, I think we must thank the humble virus because, all that technology was available, but it was never made mainstream. Today, remote working is now mainstream. And, even PwC, we've been telling our employees, you don't need to come to the office. Not today, not tomorrow, if the need is not there, right? So I think it's really transformed the way we look at work, the way we look at business. I think one of the other things was while I think there was a pandemic, we also had an endemic, and this was mental health. So I think mental health never came to the forefront. But if you look at this graph, and you look at the various generations, look at, the impact and the levels of Generation X, Generation Z, the millennials. So this really came into the forefront. And we just realized, and we went back to the classical definition, I would say, of healthcare, where it's, not only about the physical, but also the mental, spiritual, and the absence of disease in many quarters. But, like with everything, you always have winners, you always have losers. So, who were the winners? And it were the technology companies, right? So you sat at home and guess what? Netflix actually monetized your boredom, right? Because most of these companies have a network effect, the FANGs. They put in barriers to entry. You're allowed to compete as long as it's on their platform, and they punch much more above their weight. Most of the NASDAQ, 20% of the S&P index is just these 5 companies. So if you look at Microsoft, the cash reserves are so much that, they can sit on 3 years of expenses. And they have that strategic advantage. If you look at even Disney managed to transform itself. It was basically in the park industry and the entertainment parks. But when they closed down, by just having Disney Plus, they were able to, bring back, and they're a more valuable company today than they were pre-COVID. The interesting part of this is a lot of this, Facebook's playbook of, and I was reading actually didn't come from the technology industry. The playbook actually came from big tobacco. So, why do you get addicted on social media? You can always think of the tobacco addiction, right? So what happened initially when, tobacco was being sold, when you took the puff into your lungs, you coughed it out, the chances of, the nicotine actually entering your bloodstream was low. So what they did was, they put in menthol so that it smoothened it out in a way, and you got that high. I think the same thing, social media picked up. When you read a newspaper, you don't react to the newspaper, you read it and throw it away. But here, when you read something, you like, you share, you comment, and you want something in return. And in a way, every click leaves you craving for more. The other thing, I think it also made doctors really rethink their role. I was just thinking, we doctors always think that, what we do requires judgment, creativity, empathy, and this is something which cannot be done. But I think this comes out like, in a way, is a fallacy, because a lot of what hair is done is routine and process based. 90% of this doesn't really require judgment, creativity, and empathy. And algorithms can actually do it better. So I think the rethinking and the way the patient looks at the doctor has also evolved. And that gives a lot of opportunity, which I'll look at it. And another thing, you looked at this book, it says the patient will see you now. Healthcare, and I've like Geetika said, I worked all life in healthcare, starting way back in 1997 at Apollo Delhi. Healthcare, for some reason, not only in India, and I did spend about 1 year at Mayo Clinic, is always being doctor centric. In fact, if you look at who's the customer in healthcare, it's always the doctor, right? Because when you go in, you don't go and ask for an MRI. The doctor, as a customer, says you need an MRI. As a patient, you're just an incidental consumer. But I think that balance is beginning to change. Dynamics around that are throwing in great opportunities. So it's really transforming healthcare today. So healthcare is a very peculiar industry. So it follows what's Taylor's. I don't know, many of you may have heard of it or not. So Taylor's law says that basically the industry in perpetual crisis. So if you actually pick up a newspaper, 50 years ago old, and you see it'll be written healthcare is in crisis. Today's newspaper, we know it's always in crisis, right? But 50 years later, it still be a crisis, right? But because it's very peculiar, by the time you get the answers, the questions change. So while we were tackling all diseases, suddenly a pandemic came and we had no idea to do it. As soon as the pandemic gets over, so one, you can say, this is an industry in perpetual crisis. The other way of looking at it is this is an industry which has a perpetual opportunity. So if we were to quickly look, what does the world look like? And these are the three large trends, which will always happen. And you need to look. We're getting older, we're getting fatter, obesity, and we're getting actually sicker. Because, and this is not only applicable in India, but globally. So, just before the pandemic, I'd actually gone to Tokyo. And, at one of the conferences, one of the professors said, forget about the tsunami. We have a silver tsunami. We have so many people who are aged above 65, and that's going to be the biggest problem for us going ahead. We always keep coming and saying, where is our healthcare system? What's the best healthcare system in the world? And there's no true answer. Every healthcare system has flaws. You look at the US healthcare system, but outcomes even during the pandemic in the US were suboptimal. So Britain had its advantages, disadvantages. So as we're building a system for India, I think we can take some learnings, but it's going to be a very unique system for India. So we are at the same place where the US was in the 1960s. They spend about 5% of their GDP on healthcare, and we're even lower than that. But then that's when the government started moving away from a provider to the payer, and exactly what the Indian government's doing. So saying that we will provide insurance rather than actually deliver care, because for 75 years, maybe the delivery of care has been a little suboptimal and not kept to that level. And maybe the government's not the best institution to deliver care. But it sets up both a virtuous as well as a dangerous cycle. Today, the US spends 18% of its GDP on healthcare, but the outcomes are not significantly superior to, say, Singapore, which only spends 6% of its GDP. The other thing I think is healthcare is predominantly always focused on what's the acute episodic care. That means, it's on diagnostic. It means when you get into a hospital, you're treated, and that's what we perceive as healthcare. But I think the whole continuum of care has come in. And I think the most successful models will come either on the left or on the right side as we go ahead. So I think focusing on and building more hospitals, it'll always be required. But if you're looking at healthcare, look at the two extremes and see what value can you create there. And like you say, digital health has the potential to impact the entire life cycle, right? So right from your womb to tomb, everything could be done. And I've just put few things, how do you look at that? And very significantly, the way healthcare is moving, there is this whole component of how can you predict disease? And, we've been doing some work with the Gates Foundation. And one of the philosophy there is, the best ROI on healthcare or spent for a government is probably in areas where the disease does not come in. So, if you vaccinate people and the disease never actually appeared during a person's lifetime, that's probably the biggest ROI. And with AI, a lot of this predictive medicine will become much more important. So because, you have data and, you must have heard the adage many, many times, data is the new oil. In a way, I think we're moving away to this data-driven age, but you can actually predict health without even going to a person's healthcare records. These are actually things which are taken from someone's credit card, So if he's buying a lot of alcoholic beverages, the potential symptoms of depression. If your lapsed membership, you've lapsed in your gym membership and you're obese, your potential risk of diabetes and heart attack. You have a patient of asthma buying cigarettes, increased off. And similarly, if your compliance is going down. So I think our healthcare data, while we keep saying is going to be with us or with the hospital, that's not true. Your healthcare data is all over you. The other thing in India we're seeing is, and you see how complex the healthcare system is. It was a very, very simple system. You had a provider, you had a payer, and and you had the government. But look at how this is coming in. We're building a whole national health stack. And there are going to be so many opportunities on quality, claim, fraud, medical, telemedicine, aggregation, putting in platforms, cybersecurity. So look at the whole ecosystem and look at what the opportunities will be within that. And I can tell you it's limitless because we've never had it in India. And you've seen where it is. Today, companies which have been there for 30 years just have a fraction of the valuation of PharmEasy, which I think next month is going public, at a valuation of close to $6 billion. So we need to rethink what creates value in the healthcare space, not only from a delivery perspective, but also from an investor perspective. So what will really catalyze growth in the healthcare business? I think there are 4 shifts which I'm really seeing. One is the acceleration. So your smart devices, and a lot of this data, which today, like I have a Apple Watch, but the data which it gets collected, I use it, but my physician doesn't use it. So it becomes what we call digital waste. I think that's going to change it. You're going to have reaction on healthcare in real time. Then secondly, I think we need to simplify. There's a lot of minimalization which will happen. You cut down 10 processes and do it directly. There's going to be a conversion of focus, which means, if 2 things get together, it's not, the combination is going to be multifold. And then there's going to be a divergence of purpose. What do we really want to? How can you really prevent disease? And I'll demystify some of this. But the last one is what most of the unicorns have set up to do that. So I think rethinking healthcare, what really creates value, right? So are sick people better versus keeping people healthy? Today, I think for hospitals, sick people are generally better. That's your model. But how do you go and move it to where the model becomes? Today, you have a visiting model. The more you visit, the more, but you need not visit. I can keep you healthy at home. Secondly, what we really saw in the pandemic is you always came to a hospital. A hospital is a very high cost setting, even for a visit. And during the pandemic, guess what? ICUs were set up at a very low cost setting. And finally, value and not volume based reimbursement. Today, I think a lot of the reimbursement, healthcare is about 3 things. It's about infrastructure, it's about process, and it's about outcomes. And globally, and not only India, we say, okay, there's a great infrastructure, you followed what was to be done. Nobody looks at outcomes. I think an outcome most important. What is the point of looking and saying, the mortality of this disease is only 1%, if you're that 1%. I think outcomes for you, that is 100%. So I think outcomes really do matter as we go ahead. The second part is, you rethink the hospital spaces. If you look at this photograph, and this was a photograph taken during the pandemic, you see all the IV machines actually outside, right? They're all being controlled from outside because it's a much safer thing. So if you look at hospitals, what were hospitals really? They were for critically wounded people. So like I went back, what would happen? You'd have a bomb explosion, you'd have an earthquake, and a lot of people would come in. And, in this natural disaster, you put them all together and try to do it. So we were not designed from a pandemic surge. We're designed with very tight margins to fill beds. You saw the IV machines in the corridor. Patient, doctor, caregiver, your traditional care spaces put everyone together. But with the virus, you can't put it together, because this is a place where, when you're in the hospital, you're the one at risk as a patient. But today, not only you're at risk, your caregivers at risk, and the doctors also at risk. And secondly, have you found that we've also sort of got a spatial awareness, right? We think the space around us is sacrosanct, the social distancing, you don't come close. And that's there too. We feel we get contaminated if we leave the house. And we learned how literally to live in a bubble. So going ahead, I think there's going to be a lot of work to design for trust, both in hospitals and in public spaces. Are we ready for a hospital which has no patients? So, there is a hospital in the US where, the doctors come for work, the nurses come for work, the paramedical, but their whole idea, there are no patients. What they do. They ring up all the people in the community to make sure that they're complying. And the need for hospitalization doesn't come in because the incentives have been realigned. The incentives are not there when I treat you. My incentivization is if I keep you healthy. This goes back to a long time ago in China, when you paid the doctor when you were healthy and when you fell sick, he treated you for free. So I think we're going back to that old paradigm. We also need to rethink, and this is, one of the companies which, there have been hundreds of companies which thought, this is Sword Health, and many of you can actually Google it. It's in basically the virtual rehab business. You have physiotherapy, but basically you go for physiotherapy or the physiotherapist comes home. Both were not possible in a pandemic. So what do they do? Basically, made sure that they gave you a physiotherapy regime. You have a trainer on the other side. And more importantly, they actually put in markers which allow them to see how much have you improved. So if I have a frozen shoulder, I've been doing my physiotherapy, maybe it's improved by 5 degrees this week, 10 degrees next week. So I think how can you actually rethink it? And I really like they did a large amount of funding. And for physiotherapy, they said we're raising, I think, 300 million to get people out of pain. So I think both a social impact as well as a great business model. A lot of people, and I think everybody keeps saying, technology is the answer, right? Everything we try to build is technology. I think what's really important, okay, technology is the answer. But I think it's very important to get the question right. What is actually the question? Most failures, and I've worked with a lot of startups from the beginning, when they get into large funding, where they actually go into an IPO. I think it's all about the technology but what are you solving for? And I think it's always good to think about it. I'll give you an example. If Jeff Bezos were actually to run a healthcare enterprise, he'd run it very differently. He'd build the scale first like Amazon and then think about profits later. He'll expect customer base. He'll know your customers. We don't know where the customer comes from. Where does that patient walk into the hospital? Do I know what he does? And when he watched the Wall Street Journal, he knew this is the most perishable commodity. A very similar thing as a hospital is a bed is a perishable commodity. Can we actually put it to use and even give it out as a discount? And then he became the technology provider to the media industry. So I think a different paradigm of thinking. You cannot think in the way healthcare leaders have been thinking previously, because you're looking at a model which doesn't exist. and which needs to be enabled in a very different manner. So I think the great thing about vaccination, and we saw all the good news about the vaccination, I think one of the great things was that this vaccination, had it been not so urgent, would have normally taken 10 years. But it happened in 10 months because I think the competitors collaborated. People came up and, even companies which were in competition. The business model where, countries were able to put up the money saying, even if you fail, there was regulatory flexibility. There was great communication. So great success story for humanity. And now we know it's alpha, beta, delta, gamma, whatever comes, we'll have an answer for it. So one of the things is, where are we now and when will this end? I think this is always, we all had pandemic fatigue. And you see the reason why you have a third wave or a second wave, or people say, just wait till Diwali, is that, we're really tired of the virus. But, unfortunately, the virus is not tired of us, right? So we need to do that. The second thing I said is, again, mental health. We all spend so much time at home. We had fear, worry, stress, and that's a normal response to a perceived threat. But what made it really bad was the duration uncertainty. Even today, we really can't say, when will this all go away? When will it get normal? Because we all used to, we are all social animals, and that's what the virus exploited. It's not the virus which spread, it's humans which spread the virus. Also, I think you need to look at, because the way we brought in, so a child who's only 2 years old, he's told that be afraid of people because you could get sick. What are the repercussions of this, 20 years later? So I think a lot of what happens today, just like it happened in Vietnam, and they discovered the post-traumatic stress disorder only 2 decades later. So it's not only the implication today, but the implication going ahead for the next 2 decades. I think 3 changes are going to happen. One is, I think, all of you who went to business school said, operations exist for stakeholder value. But what do you do with stakeholder value when people are dying? So is it stakeholder value or is it protecting society? The second, I think we've seen environment and climate change come to the forefront. And we are all, now no doubts, because of the environment, we are living in a much more unsafe planet. And the third thing I think is, all the Fortune 100 companies now talking about healthcare. So they may not provide healthcare, they may not do diagnostics, but they want to look at the social determinants of health. And they think keeping people healthy, keeping their employees healthy is going to be, part of their charter. I'll finally end, you all know Jonas Salk. He actually discovered the polio vaccine. So way back in 1955, the vaccine was declared safe, effective, and potent. And he was actually asked in an interview, he said, who owned the patent? And you know what he said? He said, well, I would say the people own the patent. And he gave away the patent for free. And that is estimated to have actually saved 100 million lives. A lot of us may not have been there today listening to me because, our parents may have died of polio. So I think we basically, I'll end with this. He says, our greatest responsibility is to be good ancestors. So let's make sure that what we do is, because we don't own this earth in a way, we inherit it from our children, and we must make sure we give a better planet. Thank you.
Thank you so much, Dr. Rana Mehta. I think you could not have left it with a more impactful, quote, and I think that resonates with everyone across everything that we do. When we talk about environment, climate, the legacy we leave behind, and especially in healthcare, like you rightly said, I think that's a lot for us to really think about, take away, and implement in our lives. Really grateful to you for having brought that center stage right now at this conference as well, and for all the lovely insights you have shared. I think it gives a lot of hope to everyone who's listening to this. So thank you so much for your time and for sharing this presentation with us. I know you have a very, very busy, day to day, and you made time for this. We are so grateful to you.
No, thank you, Gitika. And I'm really appreciate you calling me for this, and I look forward to keep our association with TIE strong. Thank you, and I wish the deliberations all success.
Thank you so
and
much.
take care.
Thank you.
Take care.
Wonderful. Ladies and gentlemen, as we thank Dr. Rana Mehta, I now have the pleasure of inviting our keynote speaker for today, yet another illustrious gentleman, and I think became a trusted partner and household friend, especially over the last 2 years, Dr. Om Manchanda, MD, Dr. Lal PathLabs. He has led the transformation of Lal PathLabs in last nearly 16 years, from a small business to a professionally run India's largest medical diagnostics company. His career spans over 3 decades across diverse industries like FMCG, agri-inputs, and consumer healthcare, with over a decade experience at Hindustan Lever. He has, of course, not surprisingly, won many, many awards, with the most recent one being Healthcare Personality of the Year 2020, award at the FICCI Healthcare Excellence Awards. Again, a privilege to have known him for several years at TIE, a former TIE charter member. And I think this description, this introduction to him is really nothing compared to what he has achieved and what he has made Lal PathLabs, not just in terms of a diagnostics company, but even from the technology-enabled aspect of it and how they have been able to reach every corner of the country. A very warm welcome to you. Over to you, Mr. Manchanda.
Thank you, Gitika. Very kind introduction and good to see you as well. So I'm told that the audience today on this session is a lot of startup companies and founders sitting here, right? They're looking for some of the insights and some learnings of mine in this healthcare space. It's coincidental that I just finished a FICCI session also on diagnostics. While I may not be in a position to throw light on all aspects of healthcare, because healthcare is so wide and there are many sort of streams in healthcare, while most of my experience in healthcare has been in diagnostics, but I'll still try and see if I can give broad sort of themes that may help young startups to really look at where to focus. Now there are 2 or 3 things. Sorry, my throat is not that great today, so bear with me. There are 2 or 3 things all of you should keep in mind. Number one is that healthcare as a market opportunity is here to stay, and it's very long term. So you should look at this as an ever growing opportunity in a country like India, because India is highly under-penetrated and underserved for healthcare. So that's number one point you must remember, that it's a market which is going to grow at a secular level for a very, very long time. Second thing you all should know that traditionally I think it's been a very doctor-driven market, but that power to decide is actually shifting more in the hands of patient and consumer. That's the second important thing you must know, because as you focus on consumer or patient, then what you need to do to serve that need is going to get very different. So the way you market the entire thing, the way you reach out to your customer is going to change. That's a second important thing you must remember. So the first is market is very large and growing, and it's also moving more in the hands of patients. I think third very important segment, which is also a bit interlinked with the first 2 points that I make, is that traditionally we have seen healthcare for a patient, because you are unwell, you observe some symptom, and then you see a doctor, and then an entire demand cycle starts. But I think it's going to change, and it has already changed also dramatically. Because even a normal human being, seemingly normal human beings, even if you do not have any clinical symptom, is also a healthcare customer, because of people want to know, go preventive, people also want to go predictive. Nowadays, a lot of gene sequencing, genetic makeup, genetic history, etc. So it's now predictive, preventive, prescriptive, and therapeutic. So it's all this thing put together. So technically speaking, every person, whether well or unwell, is actually a healthcare consumer. So these are three things I wanted to highlight. Now, where are the opportunities for startups to look into this particular market? I think the first theme that I would say is theme of telehealth. Now, telehealth can have many things. You have e-consultation, you have teleradiology, you have telepathology, you have anything to do with that. So what does it really mean? It means that it connects two points, which are A and B, not physically, but through digital route. Now, it is being driven for 2 or 3 reasons. Number one, I think if I heard Dr. Rana talking about on this forum and otherwise as well, there is a shortage of infra, which is basically both manpower as well as physical. So I think this whole telehealth as a concept, it helps us improve the productivity. Second area is there's a lot of imbalance in the way our healthcare infra is distributed. You will see that a lot of our infra is lying in top metros and mini metros, but you go down the Popsteta rural areas, this infra doesn't exist. So telehealth solves that problem. So on one side, it enhances the productivity. On the other side, it provides access to remote areas. The second piece, which as a theme I would say, and most startups should look at, is that given this advancement in digital technology, one is generating tremendous amount of data in healthcare. Now, this data always existed, but it was never in a form of where one could put use to some kind of analytics. So I do believe that many of the traditional healthcare providers will have to undergo a lot of change in the way their applications are configured, the way the APIs are there. Some of you guys may be engineers, and look at all those IT applications which will help this data to come in a form which probably can be analyzed, and any area that you can help these healthcare providers will actually be welcome. So I would say that data generation and being organized in a manner or in a data lake setup where you are able to make some sense of it. In short, I would call it artificial intelligence, machine learning. What essentially it would mean is that once the data is in place, you're able to put some kind of algorithm around this, then you can actually provide value-added output. And if I were to take example of diagnostics, I think the most important thing is for us is not only diagnose it accurately, but I think what is very critical, diagnose it early. And I think the accuracy part was always existing. I think this early piece is now this AI and ML is helping us, or will help us even more. Because I am told in radiology that sometimes machine reading can actually be much more faster and accurate and early than a human eye can read. So there are a lot of opportunities coming up in this whole space of AI, machine learning, and all of you should look at its application in various parts of various sections of healthcare. So that's a second theme. So the third theme that I would say is that a rapidly changing consumer or patient behavior. And actually, I have 2 or 3 sub-themes in this changing consumer behavior. Number one is that if you observe, in the past, one will go to a doctor when you observe some visible symptoms on your body. And even sometimes many people used to delay that as well before they actually go to a doctor. But I think now before you see a doctor, there are 3 or 4 things which patients or consumers are doing on their own. Number one, I continue to see the real-time tracking of some health metrics, whether it is blood pressure, whether it is now oximeter, pulse oximeter, whether it is number of your ECGs. Now a lot of these Apple watches, etc. You can actually look at people track their number of steps they take per day. All this real-time data being tracked is one change that I see. Essentially, basically, the mindset is all about taking charge of your health. The second piece is also home diagnostics. Now we see glucometer available in many houses, and there are many more such innovations are coming in where people would be able to do some kind of home diagnostics. And third thing that we see is that seemingly normal patients are also looking for some kind of preventive health checkups. That's what we see in diagnostics. And then comes if you observe some kind of trends not in line with the normal trend, then you go and end up seeing a doctor. So I think if you look at the patient behavior has undergone a huge change, and COVID has further accelerated all these changes that we are seeing. The other theme under changing consumer expectation is doorstep services. Gone are the days when patients would come and wait in the queue and wait for many hours and sit in your facility. Now they are saying, come to my house, come to my home, and then deliver the service. And that is the way of life. And we have seen that in pathology as well. The home collection business is on the rise. The third sub-theme I would say on changing consumer expectation is price discovery. We've already seen this disruption happening on many other industries. I think healthcare also has fallen in that now. Thanks to the e-commerce model where you can actually compare the prices. Since the consumption or frequency of testing has gone up, so is the price discovery on the part of consumer as well. So I think these are 3 areas that I can clearly see on the changing consumer expectations. And the second last point that I want to make it is new business model. There is a disruption which is taking place these days on from traditional business models. Now you see a lot of full stack e-commerce models where there is e-pharmacy, e-diagnostics, and e-consultation all in one place, and very well integrated through apps on your mobile phone. And this is actually disrupting some of these traditional models. And the last point that I have is a lot of advancement on technology, medical technology. I'm not too sure whether this audience has a lot of medical doctors sitting here, but there is also an advancement taking place in that direction as well. So for example, genome sequencing or genetic sequencing has become, though it's a high-end test right now, we believe it's going to become fairly routine in times to come. We've always seen now molecular diagnostics, thanks to COVID, now a lot of capacity is being generated in the country. And similarly, I was actually on my panel, I had somebody from Australia and New Zealand as well. He also was talking the same thing, that molecular diagnostics, which was seen as a highly specialized test in the past, has become now a routine. Now, molecular diagnostic test actually can pick up a lot of infectious diseases very early, and also can help us deciding many of the therapeutics on the cancer side. So if I were to sum up the entire thing, I would say that market is very large and it's growing. It's highly underpenetrated, underserved, so there is a lot of scope to play in this space. The second area that I would say that, which probably I didn't make that point, is that it's a highly unorganized sector, especially on the provider side. There is a need to organize it, and there is a need to scale the whole thing, because scaling has huge plus on the making it affordable. In terms of themes, if I were to just sum up, number one, I mentioned telehealth. Number two, I said there is a lot of data being generated, so it really augurs very well to do some kind of AI and machine learning. Number three, I said changing consumer expectation, and I made three sub-points in that. Number one was real-time tracking of health metrics, which is happening, home diagnostics, screening before actually patient visits a doctor. So there are 2-3 steps which these days patients are taking on their own before they see a doctor. Another sub-point I mentioned was doorstep service. Third I mentioned was price discovery. And the two additional points that I made is that new business models are coming in, they are disrupting existing models. And finally, I mentioned about new technology, which is POCT or gene sequencing, etc., etc. So with those points, I'll end here, and maybe I'll have maybe 5-10 minutes for Q&A. I'm happy to take that.
Thank you so much, Dr. Manchanda. We do have questions which have come up. One of them is by Anjan, where he would like to know, what do you think is the scope of precision molecular diagnostics in India and globally? How can one bring the cost of these diagnostics down?
So the scope is very large because I think these days, in the past, testing used to be more chemistry based. It's an expression of some genetic level change that is happening. But with the molecular testing coming in, you are able to diagnose a lot of things more accurately and early. So the scope is very large, and what COVID has done to the whole world is that RT-PCR, the platform, which is a molecular diagnostic platform, the amount of capacity which is being generated. So technically speaking, it has generated sort of one big boost in the whole setup. And I clearly see that molecular diagnostics is going to become a way of life. In terms of costs, I think cost reduction has probably already happened. If you all recall, the 4,500 rupees price per test for RT-PCR is now down to some 500-600 rupees, which has primarily happened because of scale, and also one has been able to reduce the tech cost of testing as well as we've gone forward. So I think net molecular diagnostic is going to be forefront in diagnostics.
So the next question from Rehan: how do you feel visualization tools as that of extended reality AR VR that can help the medical and diagnostic market?
I think this has a lot of scope, and anything related to technology. And few examples that I gave, which we are already using in our own system. On the technical side, we have this whole initiative of digital pathology, where earlier we used to really make biopsies, tissues, travel from far off places to our central lab. Today, you probably don't need to do that. You make the grossing of these slides at wherever the samples are collected, and then you beam the slide or images, and someone can read it. So that's one such example of this one. We have on the service side, we have chatbots. We have even automation in terms of now may not have been in India, but I think when I travel abroad, many labs, there are so many robots which are there, which are actually doing a lot of coordination work inside the lab to move samples from one location to another location. And I think this whole tech piece is going to get invaded, get inside the healthcare system. And it's already happening. And some of the startups actually can play a very big role in doing that. In fact, I would like to share with all of you that on tech side, in the past, actually, we have been working with large names like big names like IBM, Microsoft, and things like that, because a lot of these enterprise applications came from them. But now I find actually a lot of our tech work is happening with startup ecosystem. These are not big names; they are actually Indian startups, which is really very exciting journey I see for startup ecosystem helping healthcare. And by the way, this some of you may be aware about this NDHM, which is National Digital Health Mission, which is coming up, which is all about universal health ID. Now, right now it's voluntary, but at the end of the day, for this country to realize its vision and mission, the entire healthcare ecosystem has to get integrated with National Digital Health Mission. And my reading is that all the players, including us for that matter, would need very, very nimble systems and processes to connect with that ecosystem of National Digital Health Mission. So I find on information technology and digital technology, there is a lot of scope for startups to really work with the healthcare providers.
Yeah. The next one is from Anirban. Do you think molecular-based preventive screening will see an upside after COVID?
Uh, Preventive screening, actually, based on my understanding, I'm not a technical person, but a lot of molecular testing is right now limited to infectious diseases. And you have HCV, you have HIV, you have dengue and malaria and tuberculosis, etc. So I think on infectious diseases, especially which are of public health importance, molecular is going to play a big role. But some of these chronic diseases like thyroid profile or sugar or lipid profile, they are still very, or various biomarkers, they are still very chemistry based. So I think it's not that molecular is going to replace the chemistry part of it, but molecular had its own role. But infectious diseases, I think testing is completely going to move to molecular.
The next is by Arpan. Do you think centralizing the patient's health record is going to help the healthcare market?
It's a very interesting question. I would not want to comment from a market perspective, but I'll definitely comment it from a patient perspective. I think it's going to make the entire patient sort of experience very convenient. Because if you and I put ourselves in similar sort of position, we find that none of us are actually carrying physical prescription that we got, let's say 2-3 years back from one doctor, unless there is some specific illness which we need to manage over a period of time. Many of these health records are just lying all over the place. This digital or information exchange coming in, the entire repository of data in one place, definitely going to make a big difference to the patient. So I'm sure once that happens, because right at the center of this whole activity is the patient, you will see the entire ecosystem changing and models changing. That's where some of these startups really can play a big role. But to me, direction is very clear. It's completely going to move in that direction where entire healthcare information is going to be lying in one place.
Great. The next one is from Puneet. Are the providers in India willing to organize and migrate to data interoperability? Interportability, yeah, sorry.
I think so. I know there may be a resistance, but probably over a period of time, it should fall in place, is my sense. But yeah, it's not going to be easy transition.
The one is from Chirag. How can we divert diagnostic market to doctor-driven to patient-driven? What is the tool of awareness of patients to aware about the practice?
Oh,
Work
it's already happening, right? So it's there in front of us, and it's further going to move rapidly. As I was talking to founder of Tata 1mg this afternoon, and with his e-commerce model, it's actually moving rapidly in the hands of patients, especially in large cities. I think going forward, all the ingredients to shift is already in place. But I really won't say that there is a deliberate attempt to shift from doctors, because doctors have a big role to play. Ultimately, why do we do diagnostics? Diagnostic is done to actually help someone to diagnose. Now, that someone is not always the patient himself or herself. There is an expert sitting there, which to me is a doctor. I don't think there's a desire or requirement or a need to shift from doctor to patients. I think it's just the segmentation which is important, that if you are generally, there's no visible clinical symptom, you don't go to a doctor, but you still go through a wellness testing or a path scan, which you can decide yourself. But if there is a if there is a need to see a doctor, obviously doctor is also a customer in this whole chain.
Okay, so the last question before we call it the session, from Nidhish, can you point out top 3 gray area in diagnostics, including radio, patho, and biochemistry, where India is going to see tremendous growth?
Top 3 what areas?
Top 3 gray areas in diagnostics, including radio, patho, and biochemistry, where India is going to see.
So I'm not sure what does he mean by gray areas, but let's say I think he's very keen to find out where the growth is going to come from in radiology, pathology, and overall diagnosis. I think the first is on radiology. I clearly see a disruption in the business model happening rapidly. Today, there is a radiologist shortage. Today, it's a very high capex driven business. I think both are going to change. You will see a lot of pay-per-use model coming in, where some of the large companies would say, listen, you don't need to worry about high investment to be put in, because they will be probably assured of demand, etc. I don't think that's the worry. So one change that I see, the pay-per-use model falling in place, which will make this entry barriers into radiology much lower than what they are today. The second disruption that I see is going to happen is on account of teleradiology. You don't need physically radiologists sitting next to the machine. Today they can operate, machine can be in point A radiologist can be sitting in point B, and reporting actually can happen at different point in time as well. So I think those teleradiology models are going to come, which means the cost of doing a radiology business is going to go down, and hence make it affordable is one change that I see. And you will see a marriage of both radiology and pathology together, because sometimes they go hand in hand as well. On pathology, I think the same thing. Telepathology is one big area, which the way teleradiology is. But in addition to that, in diagnostics, I clearly see that I think this is going to get more service oriented than what it is today. You will see doorstep. You will see faster turnaround time. There's going to be demand on getting tests in 2 hours, 4 hours, 3 hours, compared to what happens today. You give your sample in the morning and the results come either in the evening or next day morning. I think there is going to be a huge demand on labs to actually provide the test results as quickly as possible. I think this is going to become, it's already a differentiator, but I think it's going to become a bigger differentiator. And clubbed with the whole price discovery process through e-commerce models is going to make the business very interesting going forward.
So with that, we come to the end of the session. Thank you so much, Dr. Manchanda, for taking out time for this session. I know you had a busy day. There was a bit of change in the schedule, and you happily accommodated our request. We are really thankful of you, and we look forward to staying in touch and with engagement with you. Thank you so much. And with this, I hand it over to Harsiddhi to introduce the next panel, please.
Thank you, Nitin.
Thank you so much, Dr. Manchanda.
Thank you, Nitin. Thank you, Dr. Manchanda. Thank you, all the panelists, for joining in. And let's move forward. Finally, the time for the most awaited panel discussions has arrived. And without wasting time, I would like to introduce our first panel, which is how to realize the healthcare opportunity. Our speakers for the panel are Soumyajit Roy, CEO and co-founder, Emoha; Rajat Garg, co-founder, My Upchar; Sahil Dharia, CEO and founder, Sooth Healthcare; and Vikas Kuthiala, angel investor. We are still waiting for Vikas to join in. Our moderator for the panel is Rahul Gupta. I welcome you all, and I hand the stage over to Rahul. Thank you, everyone.
Thanks, Harsiddhi. Thanks, Nitin. Thank you, first of all, for announcing it. This is the most awaiting panel, so no better motivation to do this. I think the previous one was incredible as well, so we have more pressure to be better. Hi, everyone. Quick question from the audience. How many of you are healthcare founders? If you are, there's a reaction button at the bottom. Please give a thumbs up. We just want to get a sense of the audience. Okay, so about 1/3 of the people are founders. That's incredible. Also, if you have raised any round of funding, even if that's angel, even if that's 50 lakhs or a crore or anything up, maybe just give a smiley. It'll also help us understand. And okay, so just a couple of, maybe about 3 or 4 people. Okay, incredible. So we would keep the Q&A. Please, whatever questions you have, feel free to enter that in chat. We will try to take them as it is, because us speaking only makes sense if we can answer your questions. So on that note, super lucky to be on the panel with 4 incredible people. Soumya, Sahil, Rajat, welcome. And
thank you.
Since a lot of people here are building companies and are still in their 0 to 1 journey, right? Would definitely love to touch about the 0 to 1 journey. So would be great if all 3 of you could essentially give about a 30 seconds to about a minute of intro about you and what you're solving for, please. Soumya, please go ahead.
Hey, everybody. Thanks so much for Rahul for getting me on this panel. It's an honor. And I look after a company. I founded a company called Emoha Elder Care. Emoha is all about elders. We call elders first. In the last 3 years, we've now got about more than 3,500 elders, where elders and their children become part of a membership which takes care of their emergency healthcare, engagement, and various other support systems that they need for an elder to stay in their own home. And therefore, it's a mixture of healthcare and many other aspects which make them live a much better life. I'm an urban planner architect and I've been working for 20 years now. Thanks, Rahul.
Hey, Vikas, great to see you join as well.
Hi, Rahul, how are you?
Very well. We just started. Why don't you go next and intro yourself? We're just doing quick 30-second introductions.
Okay, so I'm a charter member since 2008. I am part of the Healthcare SIG, and I've been an active angel investor in a whole host of sectors, where healthcare services is one sector where I lead. And I think the rest you'll find out as we go. Thanks.
Great. Sahil?
Yeah, thanks. Thanks, Rahul. Sahil Dharia, founder, CEO of Soothe Healthcare. I'm an ex-banker turned entrepreneur, professional turned entrepreneur. We're a CPG company. We manufacture, distribute, and market personal hygiene products, specifically sanitary napkins, baby diapers, adult diapers, and so on. So we manufacture, distribute, and market across India. We have 2 plants already, and we operate in prestige as well as affordable segments. Thank you.
Great. I see a clear partnership between Emoha and Soothe coming up, if that doesn't exist. Rajat, over to you, sir.
Thanks, Rahul. Folks, I'm founder of MyUpchar. MyUpchar's mission is to solve for healthcare awareness and access for health in Bharat. So for that, we create really high quality health content in 6 Indian languages, which reaches roughly 65 million visitors every month. And we are also the largest teleconsultation platform in India, currently doing around 150,000 consultations every month. And at peak during COVID, our platform was able to handle roughly 1 million consults every month. That's all. Thank you.
Awesome. Great. Quick intro. Hi, everyone. I look at investments for Times Internet, the digital arm of Times of India Group. We've backed a few companies in healthcare like Clinic and Myra Medicine. I'm also an angel investor. I've backed companies like Zoconut and Spry Healthcare, hoping to do more. And there we go. Quick question, to all of you, right? What were essentially your very, very key challenges in your 0 to 1? And how did you pinpoint on a problem, on this particular problem that you started with? Rajat, would love to start with you.
Sure, Rahul. So see, in our company, I think we have a 0 to 1 and 1 to 2 problem. So in a 0 to 1, it was very hard to convince the world that, there is a world beyond tier 1. So when we went out there and we said, there's just no content and let us create it, we started seeing good traction, but we went for investment or angel investment. We got a lot of questions saying कि यार एक लोग कौन है, ये क्या कर रहे हैं, क्या कर देखते हैं लोग. So we used to rely on data from Malayalam Times and Gujarat Times and all these regional newspapers and say that these papers are getting like 80-90 million visitors in total. So there are people who are consuming content in regional languages, and this is late 2016. Of course, after that, it's a different story. Everybody has kind of woken up to Bharat and opportunities therein. Now the other challenge we have that we are facing right now is the monetization aspect with Bharat. So not many companies have really monetized this particular audience. And there are, of course, a number of challenges because our traffic is like 90% tier 2 plus. And the salary group is, typically 90% of people have salary group less than 20K, 10%, 20 to 50K. So you don't have lending companies who are ready to lend to anyone less than 50K salary, monthly salary. You don't have paying capability, the UPI use, etc., is not happening there in that particular segment as of yet. So there. I will not say it's completely not there, but it's just slow. So I think the journey that we are going through is basically spending a lot of time with educating the customers about how to consume content, how to consume services online, how to pay online, have trust on the services, etc., etc. So our challenge has been more on, because we are kind of first mover in this space. So it's a lot of effort goes in the education side of it.
Sure. On that note, Soumya is perhaps on the other side of the other edge, essentially, right? Where he also, I'm assuming, has to educate a lot because there's a big taboo around, leaving your parents in an elderly care, environment. Soumya, I would love to hear about your 0-1 and how you built your early traction.
So, Rahul, if I have your permission, of all the speakers of all the various, I think 82 people on this session, could all of you raise a thumbs up to anybody who had any, elder care concerns in the last 6 months?
I myself did.
You put a little reaction.
Yeah.
How many of you had either in your family or friends any elder care related challenges? Yeah. So yeah, I can see that. So this is what I'm saying, that when we started, I've been working in elder care for 12 years. I started the industry body called Association of Senior Living India, representing the industry body and so on. So when you look at elder care, you either think it is old age home, or you think it is nurses and attendants, or you think it is something that is not relevant to me. What we don't think is that every elder, whether you're like in your late 50s to 60s to 90s, whether you are absolutely healthy or you are like very, very critically ill, have aspirations and needs and wants and spends anywhere between 20,000 rupees to ₹1,00,000 a month. And there is nothing in this country that is there to take care of them. Nothing. And I saw Sahil talking about adult diapers, whether it is the silver economy, as we say. The silver economy is a massive economy, and I don't know to quantify it. It's in probably $8 to $10 billion economy. But what has happened in the United States and recognition as senior living is not going to happen in India. We are not going to see elders moving out from their homes to what I call warehousing of elders. ये हमारे देश की परंपरा के खिलाफ है. We will not let it happen that elders have to move into somewhere else. They have to be, and we have to make sure all of us together that they stay in their own homes with dignity, pride, And we will make sure that if a pizza can deliver in your home, so can care. And elders are not recipients. They are also transmitters. They are givers. So every elder on this call can also become, a board member, a director, a giver. So therefore, Imoha looks at how we can become a platform for elders to not just receive, whether it is emergency care and support and discounts and offers, but also give and teach and train and adopt and so on. So my biggest 0 to 1 challenge has been awareness and bias. You're absolutely right, because we have lovely, we have now thousands of sons and daughters across the world, and only 25% are NRI. It's not like that. 33% are joint family people. So you'll be shocked to so know that you can stay in your own home, adopt Imoha services. But the popular perception in the mind of a son and daughter is, oh, you know what, if I have elder care for my parents, there's a challenge. And that's a marketing challenge. So we continue to have that challenge from 2020 onwards, that when you think of elder care for your parents, you don't think of the beauty and the services and the happiness that they can get by virtue of having friends and events and activities and new experiences. We have biases that our father and mother should be how they were for the last 40 years. That's not true. Each of us can reinvent ourselves and have a beautiful life ahead. And the 3,500 members who have reinvented themselves, I call it re-attirement. They've re-attired themselves. This country has 110 million elders, and it's going to become 340 million elders, of which at least 40 to 60 million are in urban areas. So all of these elders can play a fantastic role in startups, young people, giving them direction and so on. So there is opportunity to work together, collaborate together. And my struggle in the first 2 years of awareness is now starting to pay off. A lot of people are aware of the company, but that continues to be the biggest bias, and usually on sons and daughters side.
Sure.
That my parents don't need it, whereas actually they can't live without it once they're becoming a member.
Got it. Very interesting. Sahil, you're also, would love to hear, how the journey started, right? You're in a place where there are a lot of very large legacy players already, right? And yet it is a place, it's a space still which has taboos. So would love to hear your 0 to 1.
No, exactly. The first problem was, so I'm a professional turned entrepreneur. So I'm ex-UBS, ex-Reuters. So my friends first told me, are you crazy? Like, why do you want to quit your job? Entrepreneurship at that time was not sexy. People who didn't get jobs became entrepreneurs. So that was problem number one, was why do you want to do this even? Problem number two, once you got your head around to that, was only 12% women in India use sanitary pads. I'm talking about the year 2010, 11, when I chose to move. Very few women used it. And the peer group that I belonged to said, this is not a business to get into. I mean, nobody uses the product in India. So that was problem number two. Problem number three is that you have two large multinationals sitting in there, like you said, right? So there is an obvious fear of that, what's going to happen when you are up against these two. And finally, we had another problem, which is manufacturing. There was almost no one who makes sanitary pads in India when we went into this business. So most people want to begin a business by trading, right? Buy from someone else, buy from China. But our product is so lightweight that the transportation from China to India that itself is a gross margin problem. So how do you solve that problem? So we had no choice but to go into manufacturing as a startup. And my business model, my seed capital for my startup was 8 crores, because we had to invest in manufacturing from step one. So I think we had a lot of barriers to entry, including mental barriers to entry, financial barriers to entry, even market, right? Where only 12% women use the product. But what was very clear is, in the last 10 years, that 12 has become 20 plus, right? So the usage of sanitary napkins and baby diapers, adult diapers, is galloping in India. It's probably in the range of 16 to 18% CAGR. I'm talking pre-COVID. So that's taking care of itself, because there is a huge market. There's two ways you can look at it. It's only 20% or 80% is still not using. So we're looking at it as a half glass full rather than half empty. We are seeing that there are two multinationals The way we are looking at it is there's only 2 multinationals. We don't want to be in a category where there are already 7, 8, 9 players in it. We especially are more fearful of Indian entrepreneurs than multinationals. With multinationals, it's more like game theory. We understand how rational decisions are made, and it's that game theory conversation. It's actually the Indian entrepreneurs who are able to take sometimes risky bets and pull them off. So I got a lot of comfort knowing that there are only 2 multinationals in this space, because we kind of expect to know how it would play out. And yes, we invested in manufacturing. From day one, we were able to raise that capital as a seed capital. And that actually has been one of the best things for us, because with manufacturing, we're able to create differentiated, innovative products that create that delta for us in the market. So yeah, I think in short, every large problem is actually an opportunity once you've conquered it. We love these because these are barriers to entry. So anything that you are planning to do that has large problems to scale, love it, do it, because those become problems for everyone else. You have to be better at solving the problem. That's when you have a business.
Very beautifully put, Sahil. The larger ones, the untouched ones, are definitely the ones to go behind. Because just wanted to understand, how do you, what are certain problems you want to back? What are certain themes you've seen? What are these empty spaces that no one has yet touched, or multiple people have failed at it, but you want to back those startups?
Thanks. So, before I turned an angel investor, I too was an entrepreneur in the healthcare services space. And I used to run a business which was providing emergency medical assistance service to large projects in remote locations. It was completely untouched, virgin market. International players coming into India, oil, gas, mining, construction, EPC, offshore, were obliged to follow the HSE standards, in line with their global insurance-led HSE mandate. So they had to substantially invest against the risk. And in a remote location in India, there was nothing else. So they had to therefore create a bespoke infrastructure, which my organization would help them first understand, define, put in place, run, manage, and it could be 6 months, 9-month project, 1-year project, so on and so forth. And I then exited that business and selling it off to a large international company. And then I turned an investor. And obviously, I was looking to see if there were opportunities in the healthcare services. My first thesis was, and this goes back about 10 years, that, traditionally hospitals, tertiary care hospital in India, were doing everything themselves, right? And I realized that they were on the verge of trying to unbundle whatever they were doing in-house by focusing on a few core things and then outsourcing the rest of the services to third parties, many of which were in fact being run by doctors themselves in partnership with other people. So my first thesis was that whatever are these services that will be unbundled will therefore be very fertile ground for entrepreneurs. So, for instance, home healthcare was one of them, primary care was the other, pathology was the other. And very quickly, I saw that although my thesis was right, I was late to identify any young enterprise that I could have partnered with, invested and scaled. And when I dug down a little deeper, I realized a few things, that as Sahil said, that for a successful entity in the healthcare services sector, your initial capital, depth of equipment, and sustaining power has to be a lot, because the gestation period before you can achieve any meaningful scale or monetization can be a very long runway, for which you need money and patience and hope to get patients. So if you start something with insufficient capital, then you will have great deal of difficulty in trying to survive in that growth. That was one problem. Second problem was, that a lot of the healthcare services ventures, although were conceptually in the right space, but the set of assumptions on which they were starting off are very generic. And, Everybody had the same thesis, large country, underserved, so on and so forth. It takes 3 hours to do this, 2 hours to do this much to find. And they would plunge in without any very sharply defined monetizable value proposition, and hence would run into problem. See, as an angel investor, when you come into any investment proposition early on in the game, apart from the fact that you need to see some traction, you need to see a very well qualified value proposition, what is more important is how can you partner with this founder and get him or her to the next inflection point. And the definition of that next inflection point has got to be very, very clear and sharp, which means, can we partner? Can I invest? Can I bring my network to you? Can I give you some mentoring, invite other people, so that from where you are, you will have transformed your business to the point where other investors can come in and see the onward journey of future scaling of the business and monetization. It was very hard for me to find ventures which would offer that very visible, credible next inflection point to fund. I placed many bets in the healthcare sector in India. Some of them would lose their traction because if they were making a medical device, they would get all the grants, all the awards, all the recognition. They would have fantastic people on their advisory panel. Their products were good, they were frugal, but there were very few takers. And they were relying on government orders, et cetera, which meant it put them on the wrong road where an entrepreneur should be looking to scale their business. Or some of them were, if they were, let's say, in some kind of a research, pharma, breakthrough product, creating some kind of an IP, even if they reached to a very, very good set of milestones and that looked encouraging and prospective, the depth of investors who believe in early stage combination of domain expertise and depth of capital wasn't there. And many of them had to look for capital overseas, where they would either find them subscale or they would ask them to flip with their jurisdiction and IP to US, Europe, wherever. And that would mean that anybody who was invested, was hoping to reap the upside, would kind of lose out on that. So therefore, large number of these ventures, and I really feel that we need in the Indian investment ecosystem investors who have the domain knowledge, who have deep domain knowledge, the classical angel investing, and who have the deep pockets, so that very early on they can invest in that entity as though this was a very deep tech venture where the product is still in the making, and whether the product works or not will require at least 2 or 3 rounds of funding before you feel that, yeah, this works and now it can scale up very fast. So I think the entrepreneurs are there, the enthusiasm is there, the opportunity is there. It's just that the time it takes for investors, for a generic investor to step in is very long. And we need these sort of classic angel investors who are from the domain, made the money as healthcare entrepreneurs, and want to genuinely encourage us as angels and put the money and take them up. You have the Virex and everything else of the world, many opportunities and room for getting grants and funding. But once you are exhausted of all of that, you actually find yourself pretty much abandoned from the normal investment options and opportunities that exist for other entrepreneurs.
Yeah, that's true. I think also the time has changed a lot. However, most device-based companies, of course, still, first of all, require a lot more capital to create those devices. Also, the ecosystem around manufacturing of such devices is still not there in India. However, we're definitely at that inflection point. I think people like Rajat took the front leap for creating, solutions for essentially tier 3, tier 4 India, right? So I think this is an incredible time, and I feel that time has come now that floodgates for new innovative products, or essentially payments, for example, has been solved to some extent. I'm not saying that everyone living in a tier 3, tier 4 town uses a UPI or could pay, but however, which was pretty much zero, has moved, the needle has been moved, and it's moving very fast. Rajat, over to you. What according to you, I mean, I'm going to come back to all of you with a couple of opportunities that all of you feel are still, white spaces that multiple people here listening should maybe look at, if they're not already building for it. Also to the audience, please start shooting your questions because we have only about another 20 minutes. So I want to make sure we answer all your questions. That's why we're here. So please keep shooting your questions. Over to you, Rajat.
So basically what's happening is that, when we look at our healthcare infrastructure, and as Vikas was talking about how they were creating facilities in the remote areas, a lot of the supply, a lot of the ecosystem around is non-existent. So when we think about stuff like home testing, so there are a lot of rapid cards that you can send home and people can do those tests on their own. Everything about remote monitoring. Now, so that's one area that is completely ripe for disruption. There are a lot of players who are doing diabetes management reversal. There are like 7-8 companies I know of, but there's actually a bigger possible opportunity there with multiple other categories as well. Number two, and yes, this is completely tech, so you can build these cards, scan via phone, and you can take care of that. There are a lot of devices that you can integrate with for home monitoring. The second bigger opportunity that I feel is around insurance. So that segment, I believe, is ripe for breakout. It's already happening in tier 1. Due to COVID, a lot of people, a lot of SMEs have started taking insurance. There are a lot of companies that have come up, but all of those are still focused in tier 1 and some parts of tier 2. Even there, I think adoption is really low. But if you look at healthcare premiums, insurance premiums, 94% of the premiums are from urban areas. Only 5.8, to be precise, is from rural and semi-urban areas. Now, if you look at the division of premium, 50% is group and 50% is individual retail. But group, I believe group will really go further. So as companies, as corporates who are working in all these areas, who have operating factories, they start buying insurance for which I think some of it is mandated already, but it's not happening in practical reality. I think that segment is going to really, really grow. The third part, is the teleconsultation plus these services paid for by either corporates or insurance companies. So when we look at global markets, whether it's US, UK, China, Singapore, all of these countries, you have insurance companies that are paying for OPD, teleconsultation, all of these services. And on the back of that, these services have really grown. In India, because teleconsultation, although DAI has already has already given that insurance companies can pay for teleconsultation, it's still not happening in reality. Once that gets paid for by insurance, I believe teleconsultation space will also see a big jump. And I think there's an opportunity to further improve the teleconsultation experience so that people can develop trust around it. I think that's still lacking. Like, people are taking it, but they're not developing the same level of trust. But it's also where the ecosystem is at the current time. As we have seen with e-commerce or Ola, Uber, all of them have gone through the same journey. I believe teleconsultation is at the early years of that same journey. All these three spaces, I feel it's going to really, really boom in next coming years.
Makes sense. Makes sense. Sahil, there's a specific question to you. When you started initially, how did you reach the market as a young startup, especially when the market budgets of MNCs were very high? And essentially, how did you find your product market fit?
Sure. So you want me to answer your question first and then this one, the product one?
Just go for Dr. Trisha's first, I guess.
Okay, fine. So for us, sanitary napkins is an offline product. It's only now that some online buying of sanitary pads and etc. has started. Bulk of it remains offline. So and at that time, Amazon, Flipkart were not big. When we started, we had no choice but to go offline. We started with going into an inch wide, mile deep channel, which is modern trade. General trade, to give you a sense, is roughly 10 lakh dukaan India mein, right? 10 lakh stores, which is the mom and pop kirana stores that we buy our eggs and bread from. That's where 5-star and Cadbury and juice and bread gets sold from. And that's for me a retail touch point. We were too small for that. We were too young for that. But what we did was we said, what can we attack with 4 people in the corporate office? So we attacked Walmart, Metro, large supermarket chains, where we were able to build the business, learn, get feedback on product, get feedback on our packaging, etc., etc. So in fact, Dr. Trishala, what we used to advantage was that our small size and our nimble size allowed me to actually, today we have 15% market share in certain Walmarts and Metros and certain stores. Where we operate, we do a kick-ass job of it. And on the back of that, we have now started building a distribution network. We started with Punjab, then we went to Orissa. Very, very offbeat choices we made from one to the other. So switching gears, when we went offline, we are now present in over 250,000 stores in India. But yeah, that's how we started. So the budgets of Procter & Gamble didn't matter because we did guerrilla warfare, right? We used our nimble size to our advantage. So I hope that answers that question, that their money is relevant. As far as taboo, to be very fair, while there is a taboo in the category, the taboo exists more in urban India than rural India. It's in our heads. We did a mela a few months ago in Gorakhpur. You know those mela where there is a Ferris wheel go round thing. We gave the guy who runs the Ferris wheel sanitary pads का पूरा थैला कि जो भी लेडी आपसे खरीदती है टिकट वो उसको ये दे देना, आपके कस्टमर को फ्री दे रहे हैं हम. The guy was so happy कि उसके कस्टमर को हम कुछ फ्री दे रहे हैं. He was giving sanitary pads to every woman. Pari sanitary pad. Every woman is taking it. She knows what it is. What taboo? You know. So I mean, I would challenge that notion that there is a taboo. I have more people asking me about taboo who live in South Bombay and GK than name it. Urban India, non-urban India or non-metro India is rapidly adapting to this. It's an essential item. Everybody's getting on board with it, and like Vikas said, we're at that unique inflection point where this is rapidly becoming a normal everyday item. Taboo exists for people who are 30 plus or who have been using kapra for 15, 17 years. The young girl today who follows Janhvi Kapoor on Instagram and checks out what she wore to the gym this morning or what she ate for breakfast doesn't care about taboo. And that India is accessible by almost every woman in India.
No, exactly, Sahil. That's why I was saying. I think
changed so quickly. Yeah.
At that inflection point now that almost anything and everything in healthcare, this is the time to push the paddle, right? Whether you're building a SaaS solution, whether you're building something for diabetes, or some kind of analytics, we're seeing companies, very interesting companies like, Dozy, right, which is an IoT device you can put under your mattress and it'll give you analytics if there's going to be a potential heart attack or any kind of issue, right? So in remote monitoring, I'm forgetting the name. There's a company which got into YC, which gives you, Rajat mentioned, right? Tests at home, right? So you can literally dip it in your urine and you get like about 15 parameters. So tons happening. I think this is pretty much the right time. Definitely does India have, I think to all companies, I just want to say one thing. just be cautious whether your product is made for India or for the Western world, because thinking that something like ultra human would work at that pricing in India is probably not what you want to do. Because I think it's a great company, but they may be testing in India. I'm assuming the real market that they are gonna end up launching the product in a massive way is the Western world. So be cautious on what markets you choose. Sahil, in less than 30 seconds, what are just two large categories that you still feel are untapped?
So in the general, at Sood, we believe this decade belongs to women. As our economy goes from 2 trillion to 5 trillion, and in the Asian context, women make more decisions. Women make every decision in a household other than investing, which too is becoming. So as the wallet size of the Indian household goes up, more women make more purchasing decisions, which will land up at more FMCG consumer products. So this is how the business and how the industry looks at. So we see women as a severely undertapped segment who now has purchasing power, because our culture empowers them to make purchases for us in the household, in the context of India. So specifically speaking, for us, I'm a product guy, so we look at products like intimate wash, nutrition, right? I think hygiene and nutrition are big items today, and we believe as a product, those are something that's large untapped spaces. Now, nutrition companies have come, but I think a lot more is yet to come. Finally, in terms of services, mental health as a service. Mental health is becoming and has become fairly important in this context. I am yet to see something great scalable in this space, but yeah, 30 seconds.
Thanks for sticking to that. Soumya, there's a particular question for you on, please elaborate on challenges faced by you in the beginning and from whom or which segment of service. I'm really sorry, I can't really understand that question, but essentially, if you could talk in about 30 seconds, the major challenges you faced initially and how that they've, kind of moved ahead now.
As I started by saying, the biggest thing was awareness, and we started in Gurgaon, and I wanted to take the topic of elder care head on. So, a lot of the resident welfare associations and the senior citizens associations of Gurgaon, I remember in pretty much the 3rd or 5th month after I started, and this is going back 2.5 years now, were invited into our little office at that point of time, and we put a map of Gurgaon and said, you decide which part of Gurgaon you want the emergency get addressed right now. Our technology was relatively new at that point of time, so we were a little scared, but to be honest, they did 4 simulations and all of that worked. And a couple of those senior citizen federation members continue to be members of the community today. And that was just the first dimension, which was emergency. So belief, and getting the right people, awareness and getting the right people has always been from the beginning the kind of challenge. And I think the one thing which I felt besides awareness is to have team members and keep those team members, keep your initial team members and believe in them and make them go through the whole cycle, because the organization will evolve. We started with looking at one part of the elder care spectrum. Today it's like a platform, but initially started with emergency, then healthcare got added, engagement layers got added. When COVID started, all physical activities stopped. So we went completely virtual, and today we are the largest elder care content provider in the country. Unless and until one believes in your own teams and really goes about taking care of your team members, I don't think it's possible. We are currently talking about providing elder care globally through streaming services, which is a very different orbit from doing it in your own neighborhood and 80 cities in the country. So to be able to have the right people, believe in those people, and constantly help them go to the next level, I think has always been a challenge, but we continuously keep working on it. And therefore, if you are able to make sure that your own team members are growing and your product and the customer is constantly growing, I think the chances of staying through is higher.
Great. Soumya, 30 seconds. What are some big opportunities?
For the first 1.5 year, we were focused in Gurgaon. We took a decision to move to NCR Delhi, and it was a very tough call. We are co-invested, co-founded with Loomis Partners, which is a very major Thai partner as well. Rohit Raina is my co-founding partner in this. So there was this little moment where we said that bande utne hi hai, lekin ab NCR Delhi serve karna hai, and we had ex-defense force people and all that when we spread across the whole city of Delhi. So those moments were difficult moments, but we had to take a call to expand services across. When COVID started with Hindustan Times as a partner, we decided to go pan-India. And in 10 days, we had 2,500 volunteers across the city of Delhi. So we had to take that call of faith and expand across the country. And was risky, but has paid off. Today, where we are sitting, there is opportunities which are calling, which are global in nature. So, opportunities keep coming. But I think what needs to be looked at is the perspective has to be, I would say, local. It's an old word, but I think it continues to be relevance. That while your mindset is 2.5 kilometers around where I stay as an elder, because that is where, most people who got saved in the COVID period are people who had the right local connections, not global connections. But the perspective has to be global. I'm as relevant today in New York as I'm relevant here. And therefore, why not think if we have brethren entrepreneurs who've been able to scale up ventures globally, I think the mindset should be that don't think yourself as an opportunity only in the city or in the region and so on. So if all the technology can be kept digital, kept longitudinal, kept data centric, and kept very unit positive from an economic standpoint, that at the right time, if you have to press the button, you can be relevant in Singapore, can be relevant in Dubai or elsewhere in the world, and try to keep it light. I think very important to keep it light, because then global opportunities can become real.
Makes sense. Harsiddhi has shown up. Does that mean that time is over, or Harsiddhi, do we have still 2 to 3 minutes? We have 5. Okay, great. Dr. Kurthiala, there are a bunch of questions around funding for you and me. So I've stacked them and simplified them. First is define early stage startups. Second is what investors are looking for in the team. And third is MVP versus traction versus revenue, because there were 3 questions which said, we're on an MVP, can we raise fund? Second one said, I have some traction. And third one said, I have revenue. So over to you. What do you define an early stage health tech startup as? You're on mute, sir.
First of all, I think it is essential that in the founding team, you need to have somebody who's a domain expert, right? Unless you have somebody who has had knowledge and experience in the domain where you're trying to create a solution, you're not going to get very far. Just interplay of technology and clever marketing insights and data, and you think you can create something which is healthcare. I think that's the biggest risk that you run into against investors, if not at the early stage, then perhaps soon after getting initial funding. Now, there is no generic answer to what is MVP revenue. I think the only answer I can give is I'm open to meet all of them one by one, to have a half an hour session and give them specific advice to where I think they are, what they could possibly do to move forward. I mean, getting an MVP is fine. Revenue traction is another matter in the healthcare services for reasons that I had spoken about earlier. But the presence of somebody with healthcare domain and experience and knowledge is very, very important in your venture, if I was to look at it as an investor.
Great.
To talk about opportunity, I think Sahil nailed it actually, where I think there is action.
You pressed on mute.
The opportunity, I think one is in intimate hygiene space for women, right? And Sahil is in that category, and he would know that there is a lot of products and needs that are beyond the pad that women use. I think that is an area which is going to grow very, very fast. Second, mental health. I think contextual mental health, because as we move from COVID to post-COVID, many people have got to make many adjustments in their life, in their professional life, personal life. It's gotten, intermingled, and people will have to have access to mental health solutions. I don't have a ready answer how and where, but I think the problem will stare us in our face. And third, I think nutrition, personalized nutrition. I think increasingly everybody's becoming aware that, it's not just off the shelf. You pick up something which has got protein or iron, other forms of fortification. You need to have a little more understanding of what is the nutrition that you need in your body. And then you can kind of work with some experts who will help you and walk you and take you through that journey. And last, I think for Rajat, Rajat, if you can meet me offline, then I can maybe give you some suggestions as to how you can monetize your telehealth business.
Definitely. Love to.
That's awesome. Last 1 minute. I'm going to use that to answer the last question. Somebody asked, is it mandatory to have tech person in healthcare team? Yes and no. It depends what you're building. While Sahil may also have a CTO, but since he's building a consumer brand, I think the major part there is to get expertise around distribution versus what Rajat is building is heavily dependent on technology. So yes, so it absolutely depends on what you're building. And in any founding team, every investor essentially looks at, what the team really has some deep insights about a particular industry that you're going behind, because healthcare is so broad, right? So if you're building for diabetes, what do you really know that the others don't know? Do you have some kind of an extraordinary distribution network? In Soumya's case, he's been at it for good, I think a little over 2 decades now. So investors love people who've been at the problem for really long and who are really committed to solving something. It's a pretty endless discussion. Over to you, Harsiddhi, but wishing everyone best of luck. Harsiddhi, please post Dr. Gutiala's and maybe some of our email addresses on the chat, because a lot of
Rahul, I just want to add on this tech piece, sorry, just 30 seconds. Yes, there is a place for tech. There is an opportunity, I think, in using tech in medical content for education and training. I think we are still very, very backward in the manner in which education is conducted. Content is shared, knowledge is stored with people in the medical fraternity. There is definitely room for using tech, UI, UX content for education and for training, procedures, trainings, etc.
Thanks, everyone. Thanks for the incredible panel. Thanks to all co-speakers. Thank you very much.
Thank you, Rahul. Thanks.
Thank you, Soumyaji. Thank you, Rajat, Vikas, Sahil. Thank you so much for taking time out. And I'm getting comments already that it was a great panel discussion, and it has stirred a lot of questions. And I think we are a step closer to what we aimed for. Thank you so much for joining hands with us and making this happen. Thanks, everyone. Let's move forward and listen to our young upcoming startups who will be presenting their innovative ideas from the healthcare domain. Our first startup presentation is going to be by Jajal Medical. Ketan Jajal is here with us. Ketan, over to you. Please unmute yourself. Thank you.
Thank you. Thank you for the opportunity. Could not agree more with the discussions. So we are a startup based in Vadodara. Little bit about us. So we are into complex surgeries. Our vision is to help surgeons not have any surprises in the surgery, because most of the time when they have surprises in the surgery, it's already too late. So we help them with a lot of preoperative planning and intraoperative support. These are some of the values on which we have built the organization. A little bit about the team. We have quite a bit of experience. I have been in this industry, lived and worked in US and Europe for almost 10-15 years, and have been doing this for a very long time. And something I wanted to start very early on, but really could not do it until just 2 years ago. So these are some of the examples. This is a patient in Bangalore who had a cancer. They had to replace her half of the jaw. We spend a lot of time with the surgeon doing video conferencing on planning how exactly the implant should be, so that it perfectly matches. This is a 18-year-old, 16-year-old girl, right? And she has a life ahead of us. So all that was planned virtually. We have our own MySegmenter online platform, which we work with surgeons very closely with. Not only is this visible to the surgeons, but the same link can be shared with the patients, so they can actually see what is exactly happening into that. And we are seeing this more and more, that the patients and patients relative wants to be aware of what exactly is happening, and want to get involved quite a bit. So we've done many such cases now. We have even operated an orthopedic surgeon who himself had a problem. So it really speaks of the fact that we are doing something right. Similarly, ankle patient in Ahmedabad. So quite a few of those. But really, our mission is to personalize for every patient, so that they can eventually get a better clinical outcomes post complex surgeries. Especially when you have complex surgeries, you want to plan it properly. And the way these are some of the customer feedbacks that we have gotten. The way we do it is we help them before and we help them after. Or during the surgery, right? So before means, we have a digital platform where we do a preoperative support, where the surgeon is looking at the plan, what exactly needs to be done. And then intraoperatively, we use 3D printing and the technologies to help them during the surgery. How exactly we do that? In the preoperative side, which starts with the CT scans or MRI scans of the patients to understand. These are some of the examples. When you look at the CT scans of the patients, it's very hard for even the surgeons to understand what is happening. So, we have a visualization team that really goes in, works hard to understand and create a 3D that helps the surgeon to understand what exactly the problem is. And then once that is identified, then we help the surgeons to preoperatively literally do a virtual surgery and say, okay, I want to cut here, I want to do plan here, this is where I want to put my bone pieces or implants or whatever. So whatever they need, they spend time with us to really do this right. And once that is done, intraoperatively, that's where we provide a 3D printed models. In this case here, you can see these are some of the models that they can hold in their hand. It's an exact replica of the patient's anatomy. So when they go inside, they know that this is exactly what they are going to see. We also do what we call it as a local model. So, for example, if we've done one case in Australia where we printed it locally and delivered, so that the design happens, but local printing helps us kind of accelerate our delivery. Just want to give you some heads up. There are some surgery pictures in next few slides. So if you are not too keen, you can skip the 2 slides. I won't spend too much time on it. But these are some of the surgical instruments that we 3D print and provide in the surgery. So whatever is planned now gets executed inside the surgery using these 3D printed models. So all the plastic models we printed here. We have a partner in Israel where the metal implants are printed. So these implants we deliver. These are all 3D printed. We've done literally head to toe, a cranial plate, what you see here, an entire sternum. This was done in Gurgaon, one of the unique cases. So yeah, we started with literally 2 surgeries a month. Then the COVID hit, but after post-COVID, there's more and more adoption of these digital platforms and the 3D printing, because the surgeon also don't want to spend too much time in the surgery. They want to have a better plan in hand. Now, we're seeing a lot of traction. We're seeing almost 2 cases a day now. So yeah, that's pretty much. In parallel, we're also developing our own IP around all this, like a porous structure, an ankle replacement, where as and when we hear from the field, we are kind of developing this and moving forward. With that, yeah, I want to thank you and giving the opportunity to present.
Thank you so much, Ketan. And thank you so much for sharing your ideas. Our next presenter for today is Shubham Shah from Edith Robotics. Shubham, are you there? Great. Please go ahead.
Yes. Okay. So very good evening to everyone. It's my pleasure to present our startup at the Aarogyam Healthcare Summit 2021. So I'm really thankful to AIC GUSEC for this opportunity. So our story started 1.5 years back when the COVID hit. The pandemic situation was created in around the world. So during that time, we identified some problems that if there is any type of new virus, bacteria or strain is coming out, we cannot isolate and treat a multiple infectious disease patient in the same room. So that is also taking to the just because we are with the limited infrastructure facility, we cannot isolate the patients in the hospitals. So there are no isolation facility in the rural areas. And also we noticed that during the transport, because we have seen that we all seen that one person is responsible for the around the 450 plus transmission during that his positive time. So during the transport, infected patients are not isolated. And if we talk about the traditional negative pressure isolation ward, it takes very high cost and time to develop this type of rooms. So the biological disasters, just a second. Yeah, so biological disaster from known and unknown airborne infectious disease are costing millions of lives and billions of money. So there is a need. We identified that there is a need to develop such a low cost, quickly set up portable isolation solution. So which can also helpful to the home quarantine, home isolation, and also for the healthcare facility. So after the working in this area, we came up with this solution. It is an individual patient isolation to utilize the maximum of healthcare infrastructure facility. As you can see on the left side top photo, it is the dedicated airborne infection mobile isolation ward where all beds will be equipped with our isolation unit. On the right side photo, you can see that all the attachment necessary to the patient can be attached airtightly, so there will be no air going inside and outside. Air circulation is only possible by provided windows. So doctors can operate them on very easily, and we isolate the infectious patient in that. So whenever patient exhale comes out, we do not let that exhale directly mix up in the environment. We filter it on a three level filtration, and then we perform the sterilization, and then and then only we transfer this air let that air to mix up in the environment. So these are some of our initial testing and results. So our air at the outlet complies with the class 3 level, and these are some feedbacks from the doctors we get. These are the some units we have developed and tested and pilot tested in the hospitals in Ahmedabad. So on the left side, you can see the mobile isolation pod, which will be used for the patient transport from the ambulance and within in the hospitals. So the what value, what addition can do this to the in existing healthcare facilities? So it will be providing healthcare workers 100%. We will be if our product is there in a potential market at the healthcare facilities, different infectious disease like patients like SARS-CoV-2, TB, mucormycosis, this all patient can be treated at same place. We can utilize our healthcare infrastructure at its best. It is also increase the patient intake in hospital, because there will be no need to maintain such a some kind of distance which we have to maintain right now. The another advantage are we are preventing the nosocomial infection in the hospitals. It can be a negative pressure, positive pressure. So if we are having some immunocompromised patients, so we can turn this chamber into the positive pressure chamber. So we can treat it as per the patient needs. So in all disease where the immune system play roles like HIV, COVID, all this situation, it will be increasing the patient recovery rate. And it will be also be used as the during the treatment of one patient during the autopsy, and many other applications out there. So it is we have developed it such that it can be integrated on existing beds. Like if where we are seeing our product in the market, so we want to uh, install our units on the 20% of the bed of hospital in the infectious disease patients. And in new hospital design, we are in talk with the many 3 to 4 hospitals right now, which are building right now. So they will be having the dedicated airborne infection isolation ward with 100% of our airborne infection isolation unit. Also from the ambulances to home isolation and home ICU. We have developed it such a portable way, so you can it will take a 10-minute installation. So as per the WHO guidelines, there is a 3 bed per 1,000 people is recommended for every country. So if we calculate our model and talk about the Indian population, there is a 5,500 crore market. So what are our current stage and work plan? So right now it is under the certification from the to match up and qualify the national and international standards. And within the 9 months, we are actually schedule our product launch, and our target to install 100 plus unit in next 1.5 years. So these are the some awards and recognition we gone through in the last 1.5 year, 1 year. Recently, we were featured in the Niti Aayog digital book featuring the healthcare startups in India that names Innovations for You. Our team include all types of flavors from microbiologists to life science specialists and engineers team. And we have already partnered with some of the existing industry companies which are helping us in production to the marketing. Yeah, thank you. I would like to present one small video, so which will be showing.
We can't see the video, Shubham.
Okay. Just. Is it visible now?
Yes.
Okay. Yeah, thank you very much.
Thank you. Thank you, Shubham. Our next presenter for today is Alap Adesaran from Relox Diagnostics Private Limited. Alap, are you there?
Yeah, I'm there. Just a second.
Yeah, please share your screen.
Yeah. Can you see my screen?
Yes, I can see your presentation.
Yeah. So hello everyone, and I'm thankful to GUSEC to give me this opportunity. So basically, we are working in the space of the cloud pathology. So it is basically telepathology unit. So mainly our aim is to provide the faster and the improved pathology lab reporting services in India and mainly in the rural part. So the thing is that we have come up with this concept. It is we have identified the current challenges in the pathology industry. So main thing is that the majority the pathology industry is a highly unorganized market, and more than 80% of labs are based in the rural part, like start from tier 2 to tier 4 cities, and there is unavailability of the MD pathologists over there. So there are somewhere around 1,20,000 labs are there in India, and against there only 35,000 pathologists are there. The main reason is that the ratio is it's a very big gap between the labs and the pathologists. Another thing is that the doctors, the MD pathologists don't want to work in the rural part, like in tier 3, tier 4 cities. Another thing challenge is that all those labs are very small, so they also can't afford to have pathologists in their lab. So due to that, what happening, the traveling time of the patient from center to another center to get the qualified pathologist report, it increase. The heavy load will come to the hospitals due to the unavailability of the certain diagnostic centers in the rural part, including the PHC, CSCs of the government, like community health centers, because they do not have the MD pathologists over there. And that leads to the higher turnaround time. So what we have come up with, the solution is the virtual lab, the digital pathology. So this is a comparison, what is a conventional practice and the solution with the RALOX. So in conventional thing, the thing is that the patient once go to the doctor will prescribe any lab test. So they need to depend on the collection center, like they will give the sample to the collection center and they will get report after at least from the 12 hours to 24 hours. So which delayed the treatment process. So patient need to go again with the doctor and take the prescription and start to the treatment. What happened in the RALOX system? Like once we are going to set up a lab nearby the doctor clinic or in the doctor clinic where the reporting service is available. So once doctor will prescribe that report, so patient need to give the blood to the center. From that, what we have done, how the RALOX work is, what we are doing, we are installing the software in the lab. We are integrating all the lab equipment with our software. So just technician need to take out blood from the patient and put into the machine. That's it. That machine will capture the data and send to our software. So from software, it will go to my cloud server. We do have mobile application for the doctor. So from cloud, my system will see which doctor is available. So it's work like the Uber. Once a doctor will see the report, he will interpret that report and send it back to the center. So center immediate get the report with the interpretation and signature of the MD pathologist within span of 15 minutes. So technician just need to take out their printout and give it to the patient. And via mail, message, WhatsApp and mobile application, also patient will get those data. So RALOX is the only platform right now where the data travels, not the samples. So the majority, the biggest lab chains are work on the hub and spoke model, where they do have a one specialized lab and different spokes like collection centers. So where they need to collect the samples and send it to the mayor center, which delayed the reporting time. So here you can see what RALOX is doing. We are cut down the reporting time from 8 hours to 16 hours to the 15 minutes. That's it. So which has a lower turnarounding time for the doctor and to start the treatment. Also, RALOX is contributing to reduce the carbon emission, because here the MD pathologist don't need to travel anywhere, or doesn't the sample need. Where what we are doing, we are traveling the data. So doctor can be anywhere in the world, sitting anywhere in the space. They will access those report on the mobile and doing the reporting. So what we are providing with our system like LIMS, which is a lab integrated management system. So we are providing the integration of the machine. So the beauty of that, no technician need to do any manual entry, or no one can do any manipulation particular in that data. We do have a QC validation. So every day we are doing the QC validation of the machines. So we'll ensure that all the machines are calibrated and give us the right data. Of course, the digital pathology. So here also we have integrated the microscope with our digital camera in the system. So we can also transfer the slides, the photograph and the videos of the slides to the doctors. So they can see MD Pathology app, which is a secured app, and the data analysis and the storage. So we provide them the data storage on the cloud, at least for the 5 years as per the international standard, because we follow the HL7 and the HEPA compliance in that thing. So what we have done done various pilot projects with the different organizations. So our main setup is with the Tata Trust.
Alap, you need to end in a minute.
Yeah, sure, no worries. So we have done a project with the Tata Trust with the mobile unit. So where the mobile unit will go to the different village. Even the small town have a population of 2,000. We are doing various tests over there, and immediately we are providing report in the diagnosis. So what is the advantage of that? So I'm just going through we are providing the 24/7 reporting services, even for the emergency. So it leads to empowering the jobs in the rural area and building the entrepreneurship. We are also saving the traveling time and the cost of the man hours. Our benefits are the rural areas and cities can be covered with the rural service, so they can have access at least for the basic test. We are generating the unique ID, so we can be connect with the Aadhaar card and social security number, and the electronic data as per the international startup which we are doing. The major advantage is the geo mapping of the disease pattern, where the state and the central government get the access of the data for the pandemic surveillance. The particular area-wise, region-wise, age-wise, gender-wise, they will get the data in which area more diabetic patients are there or malaria patients are there. So they can plan according that in the particular time. So that is it. Thank you. Thanks all.
Thank you, Alap, for the presentation, and I hope it was enlightening for all the viewers today. We now have to move forward, and we have come to the final part of today's summit. The last panel for today is funding sources for healthcare startups. Our speakers for the panel are Shiva Shankar, Vice President Ankur Capital, Sameer Bagela, Managing Director, Asian Healthcare Fund, Dr. Manish Diwan, Head Strategic Partnership and Entrepreneurship Development at BIRAC. Our one more speaker is Sandeep Sinha, co-founder and managing partner, Loomis Partners, but he hasn't yet joined in, so we will be waiting for him to join in. By that time, we'll start the panel. And
he has joined in.
Okay, he has joined in. I request my team to make him the co-host. So Sandeep has also joined in, and our moderator for the panel is Sushant Bhatia, Senior Investment Manager, Caspian Debt. Thank you, everyone. I hand over the stage to Sushant. Over to you, sir.
Thanks, Harsiddhi, and thank you everyone who has joined us for listening to the discussion. So we have a very interesting mix today, and there are, of course, one healthcare focused investors, two multi-sector focused investors, and we have one government body representative. So I'm hoping you'll make the best use of it, and feel free to ping your Q&A, and I would request Harsiddhi to help us kind of redirect the relevant Q&As for the panelists. I'll just start off and I would request introduction from Dr. Manish first, and also talk a bit about the organization that you're representing and the kind of investment or other services that you are providing. Please go ahead, Dr. Manish.
Thank you, Sushant, and very good evening to all the listeners and fellow panelists. I am Manish Diwan, representing Biotechnology Industry Research Assistance Council called BIRAC. It's a Section 8 company, a Government of India PSU, carved out under Department of Biotechnology, Ministry of Science and Technology, to facilitate translation of knowledge into products and technologies, and help scale the biotech industry base in the country. So we integrate and nurture biotech ecosystem in the country in multiple ways. One is creating a culture of entrepreneurship in the biotech sector, providing funding, risk funding for the innovations from ideation to POC, POC to early validation to early stage manufacturing and going into commercialization. So there's a funding element which encompasses a few lakhs to, let's say, 50 lakh rupees in the ignition grant to an individual entrepreneur or a startup, to all the way up to $1 million per startup, depending upon the stage that they are in particularly. We also support large industries or large projects which would require nationwide testing, for example, risk funding for engaging in clinical trials. So up to phase 3 clinical trials that would require really a large quantum of funding. So co-funding opportunities are available there. We also support, apart from these funding, direct funding, we also create infrastructure, incubation center network where the ideation can be nurtured and startups can be nurtured to become successful enterprises. So we have 60 specialized bio incubators across countries in 18 states, and creating a stakeholder ecosystem that engages with the individual entrepreneur or a startup. Thirdly, we also undertake national missions, for example, Make in India facilitation cell for biotech and Startup India facilitation for biotech. I also had that at BIRAC. National missions like the National Biopharma Mission, and integrate with Government of India's other national missions and infuse energy through the ecosystem. And lastly, we integrate at the policy advocacy level, taking your voice at the policy level to make institutional changes and help connect India's ecosystem with the global ecosystem to imbibe best practices, as well as bring opportunities from at the national level as well as international level to the startup ecosystem and the allied activities. I will stop here, Sushant, and come back maybe afterwards. So thank you.
Sure. Thank you so much, Manish. I would request Samir go ahead with the introduction and talk a bit more on the funding strategy.
Yeah. Thanks, Sushant. Good evening, everyone. I represent Asian Healthcare Fund. We are a healthcare-focused private equity fund. We invest into early growth stage companies, which are typically existing companies with revenue streams close to profitability. Typically, we invest in Series B rounds or late Series A rounds. As far as ticket size goes, we typically invest anywhere between $1 million to $12 million. Typically, the starting check will be $2 to $3 million, but over a period of time, we would keep increasing and over a period of time take the investment to $10, $11, $12 million. Currently, we are investing from our second fund. We have invested across different areas. We have, for example, dental clinic chain, one of India's largest dental clinic chain called Sabka Dentist. We have invested in optical retail chain, consumer healthcare chain called Ben Franklin. We have invested in medical devices and artificial intelligence-based solutions company called Forus Health, and a primary healthcare chain called HealthSpring. So that's what we have done so far. And our main differentiation is that we have, like Sushant mentioned in the beginning, we are a healthcare-focused fund, and we have a significant amount of operating experience in the team. So we have 2 senior people in the team who have actually built healthcare businesses in their past lives. And our philosophy is to engage very actively with companies that we invest in, not micromanaging them, but helping them in specific areas where we believe we can add value to companies. So that's a very quick snapshot. Happy to come back later and add more color.
Thank you so much, Samir. Would request Sandeep to please go ahead.
Hi, good evening, everyone. This is Sandeep Sinha. I'm Managing Partner and Co-founder for Lumis Partners. We are an operating investment platform, and we're focused on solving a few specific problems. And Lumis is set up as a consolidation of 4 specific labs that we work with. We have a supply chain lab segment. We have an aged care segment. We focus on future of work labs. And finally, we focus on the venture debt side as well. The healthcare piece actually gets covered as part of 2 specific labs within Lumis. This is as a part of the supply chain side, as well as the aged care side. And in aged care, given our focus on elders, we are looking at solutions that can help take care of elders within their own homes. Also, we are setting up the assisted homes facilities for elders. So all kind of healthcare solutions which are about the home care kind of oriented solutions. Those are the solutions which are of significant interest to us. So our objective is to look at things which are from remote monitoring, diagnostic side, any kind of an electronics expertise which goes for aging in place and personal health technologies market. So that kind of becomes an area of significant interest for us. The intent is how can seniors or the age related challenges be addressed from a distance by virtue of any kind of a diagnostic, any kind of a monitoring, or any kind of a communication device. So that's the sweet spot of investment. We typically invest in pre-series A, series A kind of things. On an exception basis, we'll participate in series B as well. Our typical fund size, investment size is up to about $5 to $6 million across the board. And the fundamental value proposition from our side is that we are fairly hands-on operating investors who come with a significant bit of a background from the space. So in whichever company we join hands, we basically get involved fairly hands-on from a support standpoint to make sure that the entrepreneur has due resources to be able to go out and address the needs that they have to. So that's a quick overview. Happy to come back to it, as we progress in the session.
Thanks, Sandeep. That's perfect. I would request Shiva from Anko Capital to please go ahead and introduce him and the thesis of the fund.
Sure. Thanks, Sushant. So apologies if my voice gets muffled or if I cough a little bit under the weather today, but happy to be here with everyone. So from our side, Anko Capital is an early stage technology VC fund that looks at technologies for the next billion. And just underlying as you're looking at that segment, there's a number of needs of the population there that are that can be addressed through innovative new technology solutions coming through, particularly in the healthcare vertical. So we've invested in a range of companies that are in the healthcare service delivery model, some that are actually looking at continuum of care solutions and saying how can we actually engage with patients better once they have identified that they have certain conditions like cardiac conditions and need to be supported through a longer a journey of actually the disease that they're working through. So we have a few investments on those themes on the healthcare service side. We're also fairly actively looking at other investments and have made a few on the diagnostic segment and saying how can you actually identify certain diseases earlier. We have made an investment on a breast cancer screening startup. We've looked at other areas like just reimagining how the entire food production, how we can make just the entire aspect of engaging with the consumers of saying, here's how we can bring in new age proteins, bring in other better types of food products into our diet. And we have been looking at that as part of our overall healthcare thesis as well. So we're fairly open on the segments that we're looking at. That we do have these healthcare service delivery models that we are involved with. We have models that are on the diagnostic medical device screening solutions that we look at, particularly in the in vitro space. I think we can talk through that in a bit more detail afterwards as well. But we're also very open to looking at biotech-based solutions that are actually going to be reimagining the overall solutions. For our side, similar to what Sandeep mentioned from their side, we are a early stage investor. We come in pre-series A. So we come in fairly early in some companies that once the founder has been working on a solution which could be that we see as innovative, we've come in within a few months of the company being innovated, being set up as well. So we can come in fairly early. Typically, the check size from us is $500,000 to $1.5 million, and the round size we come in with is again $500,000, probably on the smaller side. We're happy to participate in rounds that are up to $3 million, and through follow-ons we would deploy up to $5 million in our investee companies.
Great. Thank you so much, Shiva. So just a quick introduction from myself. My name is Sushant Bhatia. I'm a regional manager for Caspian Debt. I manage the healthcare portfolio and also the South India portfolio in general for Caspian. We provide collateral-free debt to enterprises and startups who are professionally managed. Now, this covers venture capital-backed startups, and we have also funded startups who have been probably smaller capital, a few of them surprisingly bootstrapped and scaled, basically help them maintain either their cost of capital or working capital and either delay their equity round or even the best thing of course is to never dilute. I mean, we've not seen that happen, but yeah, we support enterprises in that. So moving to the next part, right? So healthcare, of course, is a very, very big spectrum. There is biotechnology, there is diagnostics, there is delivery, there are medical devices. Let me start and go back to Dr. Manish in terms of, because BioRec, of course, it's biotechnology, and I would love to know from him and for the audience itself, how exclusively are we talking about biotechnology, and what does it include for you, and also maybe talk about things if it has changed in last 2 years, because we of course are still in a pandemic, and did it change that any of your focus?
So Sushant and colleagues, I think first of all we must celebrate and congratulate each other for achieving 100 billion vaccination. A great feat in India. So 100 crore people getting immunized with vaccine. I think that's a great feat. With COVID, I think the healthcare has actually gained recognition, I would say. Even at a layman's level, we now recognize what is a vaccine has to go phase 1, phase 2, and then phase 3 clinical trial. Everybody is aware there is a PCR test, there is a rapid antigen test, and there is a RT-PCR test, which takes a little longer. What is bacteria? What is virus? There are less number of molecules working against virus compared to bacteria, etc., etc. So I think there is a recognition, and each one of us would have measured our O2 saturation levels, right? So this has actually brought in a recognition at the common person's level as well. Healthcare has been integral and has been a focus for all particular national as well as international reasons. Everybody recognizes healthcare as a very important segment. Biotechnology is a piece which integrates multiple sciences. It's an cross-disciplinary area. It integrates medical devices, diagnostics, included for therapeutics, prophylaxis, wellness. It includes industrial biotechnology, where molecules or enzymes or proteins get synthesized using mammalian bacterial cultures. It includes industrial solutions that are most cost effective, faster, using biotechnology reagents, have a cleaner environment, less of pollution. So waste to value, for example, a conversion of waste material into fertilizers, biogas. And it also includes our largest focus area, which is the agri. Agri-tech can actually create more value and create different varieties, gene editing, crop selection, seeds, etc. So it's a broad spectrum. So this is what biotechnology, how we define when we facilitate innovations, startups, or or SMEs or large industries into the biotech sector. In the COVID, as I mentioned right in the beginning, there is a heightened attention for the particularly healthcare sector and biotechnology inclusive. The ecosystem in the country has reached to a level which could quickly respond to the COVID challenge. And that we have seen. Vaccine, we have all understood, there were large players who were actually producing or manufacturing billions of doses of the vaccine. But you could also see the COVID diagnostic tests. Initially, in the beginning of pandemic, we were actually sending samples, biological samples outside India, just to get it tested whether the person has been infected or not. Over a very short period, we actually flipped from sending samples to actually making kits within India. Probably in the earlier phase, most of the reagents, 70 to 80% of the reagents were imported. Then over a period of time, we actually started creating those raw material within India. So it was 100% made in India, developed in India, designed, developed, and manufactured in India kit. So from 5,000 rupees per kit, the kits which are now available, they just cost about 200 or 150 rupees per kit. So the diagnostics have really been a major achievement that we saw in the COVID days. We also saw the manufacturing of N95 masks, PPE kits. We were never used to be making these N95 masks or PPE kits in India. So we have become now net exporters of that. Likewise, solutions for remote monitoring, sanitization. So many even around COVID itself. So COVID period, last 2 years period, has actually challenged the ecosystem. And India's ecosystem, innovation ecosystem, unlike any other, has responded and responded successfully in order for India to reflect that it can be Atmanirbhar. And there are success stories all across. I think this has paved a very strong confidence in the ecosystem that India's this ecosystem can actually respond to other challenges, non-communicable diseases or other unmet needs, which so far has been eluded and we haven't really participated much. So I think for me, this is how I look at the ecosystem which has evolved over past 2 years.
Yeah, thanks, Dr. Mani. So I really like the part where biotechnology is almost so close to consumers. Now we understand it, right? We understand it much better, and of course, the innovations have accelerated in terms of diagnostics. So thanks for highlighting that. So I'll come to Sameer now. Sameer, in terms of your funds focus, in terms of subsectors, are there any particularly positive or negative sectors for you? And how did COVID change that?
Yeah. So, like I said, we are healthcare focused. So within healthcare, we invest anything directly or indirectly linked to healthcare. But there are some areas that we like. So, for example, in healthcare delivery, we like specialty clinics. Single vertical, multi-location kind of operations, where you create a cookie cutter model and then replicate it pan-India and globally. We also have been exploring healthcare in tier 2, tier 3 cities. Medical devices is an area that we also like. We are seeing a lot of innovation. I think the great work that people like Bayrak have done have created a very strong pipeline of medical devices company, which are innovative, targeting the Indian market and emerging markets. So that's an area that we like. Wellness and preventive healthcare is an area that, again, has come into prominence. That's an area that we are tracking. And health technology, which essentially deals with everything from customer acquisition to supply chain management to the managing the back-end R&D systems, etc., is an area that has again got a big boost because of COVID. So that's an area that we have been tracking and we find very interesting. Pharma, biopharma is an area that we have always liked. Consumer healthcare and healthcare ancillary businesses. So these are some of the areas that I would just say are some of the areas that we like. As far as the impact of COVID and the change, I think COVID has had one big change, and that is, like Dr. Manish said, healthcare has become much more prominent as far as the consumer is concerned, the government is concerned, and therefore a lot of changes have taken place in the way we look at healthcare. There is a movement towards formalization and consolidation of the sector. So organized players. So, as you know, most parts of India, most Indian sectors are heavily unorganized. So that is changing with consumers moving towards trusted brands, organized players. So that's an area that will play into our thesis of specialty clinics, for example. Then digitalization, which has got a big boost because of COVID, with consumer mindset changing, with regulations changing. And that's an area, again, like I said, will lead to much faster acceleration for health tech companies. Then third big change is disintermediation, where consumers are preferring to directly interact with the healthcare provider, removing the intermediary. So D2C models will come into prominence, and these are plays, especially in the consumer healthcare space, that we will look at. Then you look at made in India medical devices. So with both the higher spending on healthcare, as well as the Atmanirbhar campaign, we will see a lot more focus on buying more affordable, more suitable for India medical devices products. So that's an area, again, that we think will get prominence. So broadly, I think that has been the big change which COVID has brought. And we continue to be very excited with the sector.
Thanks, Samir, for highlighting some of the subsectors. I hope startups are listening on the industry trends itself. Sandeep, what are your thoughts in terms of subsectors? What are your kind of focus areas, and did pandemic change it, if at all?
So Sushant, the way our focus is, like I was saying, that we are a little bit more granularly focused on two different cuts. So one is from a supply chain standpoint. So that's where we are looking at all the healthcare solutions from logistics, availability of these solutions, movement of these solutions globally. But more essentially, I think coming to the aged care segment that we've talked about, that's a segment that has seen probably the largest impact of COVID. A lot of the seniors across the board were not able to step out of their homes. They were looking for even basic solutions to be able to take care of their health. And I think if you look at various segments of the social setup, that's one particular demographic or cohort which probably saw the most amount of challenge with respect to the COVID. So within that community, and that community being fairly large, there is an immense need of being able to figure out how to be independent and how do we take care of themselves. And these elderlies are, generally, even otherwise, they are at a greater risk of many diseases. They're likely suffering from a lot of chronic conditions, cardiovascular cancer, stroke, diabetes, and so on and on. They not only need a more frequent intervention, they almost need a daily care where they can take care of the challenges that they're facing with. And this is especially because a lot of the family members may or may not have access to these elders, especially in cases, where a lot of the kids are staying abroad globally and internationally and cannot travel to India to provide those supports. So because of those situations, when we were looking at the whole bunch of solutions, our first focus was, are there good wearable devices for monitoring the elderly? And there are some basic solutions available, but I think we need a little bit more advanced and a little bit more cost-efficient ways of kind of putting together solutions like that. We are also looking at, the connected sensor platforms for home monitoring, which can basically flag off exceptions, which can flag off challenges, and then the control towers can pick it up and say, how do we kind of do it? Within specific chronic conditions, wearable devices which have to do with, let's say, the diabetes management and so on, they are becoming more and more critical because a lot of people want to be taken care of that without necessarily going to a clinic or a center, especially because of COVID concerns. A lot of seniors have been avoiding traveling outside. To something really, really basic, we have been looking at solutions like pill boxes to increase the medication adherence, because there is a tendency to be able to forget and not take those solutions. So I think it's a combination of a lot of these kind of solutions, which, if combined with some kind of a service element, can create an ecosystem of care for seniors across the board. And I think a lot of these solutions perhaps are applicable to the larger demographic in general. But from our standpoint, we're trying to see the ones which cater to the elderly population in specific. So that has been the large focus. And what we've also found is that a lot of these solutions, the affordability is not necessarily an issue. So a lot of seniors have that solution affordability, so that's not necessarily a challenge. As long as I think we can deliver value for the kind of solution that we're providing, I think there is a tremendous market for rural. And finally, we are seeing an opportunity to be able to kind of combine product and service combination together so as to be able to deliver a continuum of services, which is not to say that there is a one piece available and just go and figure it out, because in our demographics, the one that we're talking about, they don't necessarily have the ease of use or as much of digital savviness to be able to figure out those things. So we are trying to look for solutions which are not necessarily just product or technology based solutions, but we are looking at more and more innovative services solutions which can kind of integrate with the technology or a platform product side to be able to give a comprehensive care of continuum for our demographics. So that's the broad area that we have been kind of looking at.
Thanks, Sandeep. And thanks for highlighting rightly that geriatric care, which was already lagging, it is now come to the mainstream, and gaps are kind of widely visible to all of us. Moving to Shiva. Yeah, Shiva. So in terms of you being anyways a multi-sector focused, right, fund within healthcare, what kind of sectors do you include, and are there any exclusions? And how has pandemic changed things for you?
Yeah, so I think, Sushant, we're pretty open on actual segments we look at. I think the ones that we would be closed off, it's more about a commercial call of saying maybe, for example, if we take pharmacy distribution at this point, there are larger kind of startups there already, and they're kind of eating considerable market share. There's still room for other companies to come in, but probably less likely we go into those segments than some of the others. But I think especially what Sandeep called out right at the end, I think for us that's a really interesting aspect from the service delivery element of saying, how can you get involved with continuum of care? And it's absolutely true in the segment you talked about, but I think it's true very early on as well. And taking your question of what's changed, with COVID, what changed is people are more comfortable and accepting of the fact that you need to start doing preventive care, and they're comfortable saying, I need to actually start going through some of these scans early. So for some of these applications, if you can build up a model which has a strong diagnostic element or expertise, that it allows you to start layering in of saying, can I actually now either develop a solution which is either a completely revolutionary diagnostic solution which can change how globally scans for certain sets of diseases are done, or you could say, I have a system which fits in very well on an ongoing basis. And diabetes that you mentioned is one of those that you can plug in very well with the patient's ongoing use case of saying, here's how it can fit into your lifestyle now, and can we actually plug in there? So those are, I think, interesting opportunities for us as we look at the customer-facing service delivery element of saying, can you get some of these built out? For us, the healthcare, we have a broader lens of what we look at, including some of the biotech companies, including some of the deep tech innovations, as well as saying the drug discovery space is in some ways not really been optimized. A lot of these technology solutions that are being built out more centrally, if you think of the way artificial intelligence is allowing you to start testing, replicating, going through processes, and you've seen this with CRISPR launching as widely, and just the ability for you to actually start getting into what AlphaFold's done with protein testing. Can you actually start getting into the drug discovery element and actually accelerate that entire process? So there's some opportunities we're looking that are even more on a kind of core infrastructure technology of saying, can you build up innovations in these areas and have be significant impact, but not be consumer facing? So for us, it's a mix of these B2C and B2B use cases as we look at it.
Mm-hmm. Thanks, Shiva. And I'll continue the next question to you, Shiva, in terms of sector healthcare. How different is it for startups to raise funding, and are there any specific sources that they should look at? And since you look at multiple sectors, are there sort of different set of companies who have raised particular form of funding that you see within healthcare? Maybe it would be interesting for entrepreneurs to tap into.
Absolutely. So just carving that into a few different segments, Sushant, when you're looking at ones which are service delivery, and Samir did mention this, when it comes to models which are more conventional, we're saying where there is, whether it's eye care, whether it's dental chains, there's ability for you to actually self-finance or finance those from more conventional capital sources. But especially when you're looking at new innovations coming through, and Dr. Manish from Bayrak is here as one that actually funds a lot of these early innovations of the journey to actually get a product market. If you're doing a completely new diagnostic screening solution or trying to get a new type of medical device that can get used in surgeries, the journey to get approval is pretty long. So it's difficult for a institutional fund normally to do it. So which is why you don't see venture capital quite aggressively deploying in that segment as some of these others, which are more consumer facing application of either technology of saying I have a app-based interface on top of what was already happening. Those are easier areas to say I can get VC funded earlier if I have certain metrics checked out. But I'd say when you're looking at these medical device innovations, product companies, it's a longer journey to actually get to market. And there are resources like Bayrak, like CCAM, that would be fairly appropriate to actually leverage as you scale up. When it comes to the more conventional business models, like an eye care chain, like a center which is going to either be doing dental services or even involved with kidney care, what you'll find is there's profitable unit economics you can build out, and then there's models and investors like yourselves at Caspian, or even there's a USAID program through PEHEL that's helping, that's come in since COVID, of saying, can we help some of these regional centers scale up and allow more debt to come into these organizations to get it to a certain scale, at which point private equity capital can also start to come in. But the early capital source then just moves to be a slightly different pool.
Yeah, thanks. Thanks, Shiva. So I'll come to Dr. Manish. So Dr. Manish, in terms of two parts, one is within Bayrak, are there different kind of capital tools that you use? Are these loans, grants, equity? And second question, in general, in terms of sector, let's say specifically on medical devices and products, do you see capital being available sufficiently? Are there any sources, government or private, that where entrepreneurs can really tap into and keep a list of them?
So I think we have different models of funding, and some are grant in aid, equity, soft loan, and somewhere royalty component is also built in. There are co-funding options also. So at the earlier stage where it is purely innovative idea to, let's say, POC, at that stage you will find people do not participate in funding. So private investments doesn't look at the risk innovation capital access. So at that stage, we provide grant in aid. And for the understanding of the audience, grant in aid, there is no stake involved for the government here. So even the IP also stays with the innovator. So we do not take away the IP as well, or no equity, there's no follow through. If you succeed, that is yours. If you fail, then also you don't have to pay anything back to us. Then once you have achieved incorporated a startup, and for example, you have achieved TRL3, technology readiness 3 level, where you have POCs. At that stage, we have introduced an first ever exposure to startup, a small amount of equity. And once you cross that stage, attract some funding, follow-on funding, then we have others follow-on equity scheme that can give you an access to, let's say, 1 crore per startup. Likewise, as you move towards progress towards manufacturing and commercialization, there we ask for co-funding. Large industry or large projects, we partly fund up to 50%. So 50% fund can be brought in from the applicant itself. So such as like clinical trials, as I mentioned. There are some elements in some places we have also kept that in case a startup or entrepreneur becomes successful down the line 7-8 years later, then some amount of royalty can be shared with BIREC only if it gets successful. We have also introduced one beautiful piece of instrument, which we call it product commercialization fund. This we provide for, let's say, access to raw material, hiring, marketing team, manufacturing, early stage manufacturing activities. So this is more like a soft loan. So in 8 years time, you can actually, 5 years time, you can return without any interest. But if you want to take up to 10 years to return, there is some percentage that gets added. So these are various instruments that we have been using. And there are philanthropic organizations, VC funds, angels who also partner with us. There's fund of funds that we operate where we have co-invested as a minor investor in the fund in AIF. And then that AIF actually invests in the startup. So the idea is that what we invest in that AIF, at least 2x of that goes into biotech startup ecosystem. So fairly large basket of instruments that we operate with.
Thanks. And any inputs on similar, let's say, early stage pre-revenue kind of capital available for healthcare entrepreneurs apart from BIREC? Can you, if there are any on top of your mind, any government or private sources?
So I think all the sources put together enabler, just like I was just before this forum, there was a seed fund scheme of DPIIT, which provides up to 5 crore to incubators for early stage investment in the entrepreneurs and startups. So like that, there are certain elements. Department of Science and Technology also participates in creating that enabling environment. But as you progress forward beyond, let's say, TRL5, TRL7, the follow-on funding through the angels, industry, VCs, and HNIs, or industry co-participation, that is what is being the most helpful and forward-looking instrument, where the successful startups have shown to win these investments, as well as competing at national and international level, showcasing in the platforms to attract not only funding from, let's say, India sources, but outside India sources as well. So these have been some of the early, I think, viable options that have come in. the banks have kind of shied away essentially in sharing capital with the early stage or pre-revenue startups, but some banks have come forward. DPIIT has been very supportive by creating several incentives and several promotional schemes so that these fundings become available. But by and large, one can look at up to Series A or just about pre-Series A, but beyond that, I think there is a struggle, and we need to infuse more amount of funding provisions, and we can look at VC and the private equities coming into being, as Samir is there, Series B. So like that, we can have multiple players coming in. That will really spur up the ecosystem.
Yeah, thanks, Dr. Mani. So before we wrap up,
Can I just add something?
Yes, I was going to come to you, Samir. Please.
So I just wanted to mention that one of the other sources of capital, especially for early stage startups, is this whole host of angel networks which have come up in the last 5-6 years. Mumbai Angels, Indian Angel Network, Kiritsu Forum, One Crowd. So there are a bunch of these people who are doing early stage stuff. And therefore, and especially companies which are product companies, medical devices companies, I think some of them are interested in it. So that is one source that I would encourage people to actually explore.
Thanks, Samir, for highlighting that. Sandeep, any final thoughts on different sources that startups can tap into?
No, I would just add to what Samir was saying, that Samir mentioned about some of the Indian platforms, which are the different angel groups. I would strongly encourage that a lot of the solutions that we're talking about are actually truly global in nature. So I think when it comes to the funding, I think we should not, or the entrepreneurs should not restrict themselves just to the Indian platform. So I have seen a lot of successful companies originating from India, but coming out of the Y Combinator kind of a platform. So I think we should truly evaluate the scope and applicability of our products. And if our products have a truly global nature, then India could truly act as a crucible to test out the product, do the first launch, get the first set of customers. But we should be very clear and careful in determining the long-term market for that, whatever the healthcare solution is. And if there is an element which applies to a little bit more on a region or a global basis, then we should not underposition our solution purely from a one geography standpoint and restrict our options accordingly. So, entrepreneurs are always ambitious in an aspiration. So the desire to be able to go out and test out some of the most amazing platforms globally should always be there. And a lot of investors are now kind of stepping into the early stage side as well. So investors who were earlier only, towards growth stage have now opened up the doors towards early stage. So whether it is on Google and Ventures on one side, or even on platforms like Sequoia Surge and so on and on. So the acceptance towards supporting the entrepreneurs in the early part of the growth journey and being a part of the company from very early on is becoming a more and more vital proposition. So leverage that on fully. Think of the value proposition from a global standpoint, and also accordingly think of investor from a global standpoint.
Excellent. Thanks, Sandeep, for highlighting that. Pandemic, of course, has brought healthcare into highlight, as many of us have mentioned. I think many entrepreneurs can think of it as an opportunity to play on a bigger scale. Thank you so much, Shiva, Manish, Sandeep, Samir, and thank you everyone for tuning in to listen. I hope it was useful for you. Over to Harsiti.
Thank you so much, Sushant, Shiva, Manish, Samir, Sandeep. I am glad that we could do this panel because there were so many questions in the participants' minds, and when you started interacting one by one, each of them were answered. And I'm sure you have given a lot of food for thought to them to think on and act upon, and maybe come back and have a few more questions for you. So I request all the participants to please make sure that you fill the feedback form. Because there also, if you have any questions that you have in mind, because we are out of time, so you won't be able to take any more questions. But let's do one thing, put those questions in the feedback form, and we'll make sure that we get the answers from our speakers and get back to you over those. I request all of you to go check aicgusec.org/Aarogyam page for the Aarogyam challenge under the Aarogyam Summit 2021. The last date for application of the challenge is 30th of October 2021. So I request all of you to please make sure, go check it and apply before you miss out this opportunity. I thank each and every one in the panel. It was a great panel. Thank you so much for joining with us, and we hope to have a long continuum with all of you in future. I thank AIC GeoSec and also TAI Delhi for partnering with us, and all our other supporters and outreach partners for making sure that this was a successful summit. Thank you, Nitin, also for supporting us through and through from day one.